Hey, good morning. Oh, where'd I go?
Oh, you know what? The virtual camera must be.
Give us just a minute here, guys. It's okay. Let me help. Hold on. I can't see.
We have to reset the black magic design.
Can you go over there and just see if I can pick you up?
Nope.
Yeah, it's not picking you up. Okay. So unplug black magic. Plug it back in.
Can you tell it's Monday, guys?
It is Monday. Okay, try now. Yep. Okay.
Just full screen that. We should be good.
Okay. Oops. Let me go click my button here. Ah, look at that. We are up and running. It's Monday. Okay, good morning. Good morning. My name is Miss Patty. I'm going to be your guide on this journey. We're going to make this as easy as possible to learn, but also make you successful on the state exam and in your workplace later. But it's not all that difficult to go through, okay? There's going to be a lot of material that we're going to cover. By the second week, you will know everything on that back wall, all of those banners, but you're not going to be memorizing. You're going to be learning. There's a difference there. Okay, I'm not going to send you back with a whole bunch of stuff to memorize. We're going to learn it along the way. This class meets on Mondays and Wednesdays from 9 to 1. So don't come tomorrow. I won't be here. Okay. So not Monday through Wednesday, Monday and Wednesday from 9 to 1. There's 8 total class sessions. And for today and Wednesday, I'm going to talk nonstop for 4 hours. So it's a lot of material that we're going to cover. There's no busy work in this classroom. It's all stuff that we need to pass on to you that you are going to need to know either for the test or in your workplace. So there's no fluff here. Okay. But that means that I'm going to cover a lot of information in 4 hours. And chances are you're not going to remember every word that I say. So we live stream these classes out. We are now live. Hi. We have people that are joining us from all over the nation that will remote in and watch. You will see their questions pop up on the bottom of the screen as they ask questions live, and I'll answer them live. So if you cannot come to class for any reason, Wednesday, the weather is horrible, or you have a flat tire, or your AC is out, then you can remote in and get the exact same experience as if you were sitting in this classroom. The camera's right there. You can ask questions, you can interact as if you were here. Now, we open that up to everybody. That is free for all people to be able to access our live stream, okay? But it's also a benefit for you. Now, those live streams will be available on our website. Your class, your specific class, will be available on our website until the next session starts in September, I think. So you can go back and watch today's exact class 6 weeks from now. Okay. So what's your name? Kaylee. So Kaylee is one of your classmates. Hi, Kaylee. You now know that this is your class. Okay. It's not a pre-recorded of somebody else's. This is yours. It'll be up on our YouTube channel forever for you to be able to refer back to. Okay. So you can go to flcnatraining.com. That's the same website you guys signed up on, flcnatraining.com. That's where the replays will be. You can also get the class worksheets. At the end of every class, we're going to pass out a class worksheet to you. Those are up there on that site too. So if you can't make it to class, you still have access to the class worksheets. Okay, good, good. We do send wrap-up emails after each class. How many of you guys got the welcome to class email? Okay, if you did not get the welcome to class email, let us know so we can check your email address. But check your spam folder and promotion folder because sometimes our stuff ends up in there because we use an email processing program. All right, and then you all got enrollment into the online course as well, which we'll go over a little bit later. So that's all part of your classroom enrollment. So to get through this class, we are going to have 2 books that we have to get through. It sounds a lot worse than it is. This is your homework book, the yellow one. You're going to take that home today, leave it there. Leave it there. That is just for homework. That's it. Just for homework. Good? Good. This is the one you need to bring to class every day. This is the one that we actively work out of every day. This is yours. You can keep it forever. You can eBay it. You can burn it. You can do whatever you want to with it. It is workbook style, so you should be writing in it as we go through the lessons. Okay, but this one, please don't write in it. You'll return this one on the last day. Good? Good. I don't really like this book, and I'll explain why when we get into it about the halfway point today. There's some things in there that I think could be done a little bit better, but it is very short for a textbook. It's written in 6th grade English. I mean, the words are small, the writing is big, and there's lots of pictures. It's not real hard to get through, and it gives you some information that we're not going to be going through in class lectures, and that's why you still have to read it. Because I haven't gotten around to writing my own. This is mine. You can see my name down here. This book is used by schools all over the country. All right. Any questions on that? Good. Periodically through today, I may point at you and ask your name. And I do try really, really hard to learn everybody's name. I am not as good at that as I used to be. The brain cells just don't talk to each other as well as they used to. So if I ask you your name multiple times, please indulge me and help me out because I just don't work the way I used to. We'll talk about that with aging a little bit later in the program. Does anybody have any burning questions before we get started? No, everybody's good? Everybody is here for CNA, right? Good. Okay. All right, so the first thing that we have to learn is what is a CNA. And I'm going to show you a video for this. And the video is kind of an animated style, but it goes over what a CNA is, how we figure out what we're supposed to do with each patient, and what we're supposed to do with any observations that we make. So it kind of goes over the foundation of what a CNA is and what we do. You can fall asleep through anything else in this program. This is the one video that I'm going to ask you, please don't fall asleep through, because if you don't get this part, the care plan and the importance of the care plan, the rest of what I teach you isn't going to make much sense. You're going to have a million what if questions. And what I'm trying to do is help you simplify this topic so that we can build on it. If you start out with... Anybody know how to become a rocket scientist? Right? You don't start out in rocket science, master's program. You got to start out with algebra, right? And if you don't understand algebra, you're certainly not going to understand rocket science. Does that make sense? So what we have to do is kind of reduce this down and then build on that solid foundation. So this video that you're about to see is going to provide our solid foundation that we're going to build on. Sound good? Good. Okay. I've even taken the notes for you. So if you open up this book, your skills book, to page 17, you're going to see this page. This is going to tell us the important points of the principle that we're learning. this is going to show, this part over here is going to show us all of the skills that this applies to. And for skill rules, it's everything. Down here, it shows you we have a video. This video I'm about to show you is on our website. It's also in the online course you guys have all been enrolled in. So there's a lot of places to find this. And I don't expect you to take notes. If you go to page 18, these are the notes for the video that we're about to watch. So you don't even have to take notes. Sound good? Just kind of stay awake. All right. In this presentation I'm about to show you, it's going to talk to you about activities of daily living. And I do have a lesson on that. It's a little further back in the book, just so that you know where that lesson is. Now, you also have a syllabus in front of you. Your syllabus looks like this. Your syllabus looks like this. So if you don't remember all of these pages I'm telling you about, they're either going to be in the second or the last column. And we'll talk about how to get through this syllabus in a little bit. Good? So your syllabus goes over all of the pages we're talking about now. All right, so let's go ahead and watch this video. We're going to get this out of the way, and then we're going to talk about it. The Care Plan and the CNA. Why it's always about the care plan. A presentation brought to you by foryourcna.com. Thank you for joining For Your CNA's online CNA Test Prep. We will be preparing you for both the written and skills portion of the exam. This course contains videos, interactive lessons, activities, testing care plans, test registration instructions, practice questions, and much more. This program goes way beyond our skills videos available on YouTube. But in order to pass the test, there is one single principle that you must understand: the importance of the care plan. Without this key, learning the skills is meaningless. You might be able to mimic what I do in the skills later, but chances are you will fail the test because you didn't follow the care plan. So this course will teach you the skills, but you must first learn how those skills need to be done. So come on inside and I'll explain to you how the care plan works and why it is so important to the test. We are sure that you will become great CNAs and you will provide excellent care for our residents. But before you get started, let's review some basics. Does anyone know what the initials CNA stand for?
Certified Nursing Assistant?
That's exactly right, April. A nursing assistant is there to assist the nurse. You will be receiving all of your instructions from the nurse and must follow their directions. This will probably include taking vital signs and assisting with personal care tasks. But you may also be asked to assist with other nursing procedures as well. It is important to only do the things that you have been trained to do. If you aren't sure how to do something, ask someone for help. It's okay to not know everything. But please, don't try to do something that you aren't familiar with. It might harm the patient. In this online CNA Test Prep program, we're going to show you how to do all tested skills. But that is only the beginning of your education. You will learn way more on the job. Because every patient is different and will have a different way that those skills need to be done. And that's where the care plan comes in. As a CNA, you will be expected to assist our patients with many routine tasks. Generally speaking, CNAs help patients with things that they can no longer do for themselves. Things like sleeping, toileting, grooming, bathing, dressing, eating, socializing, and activities. Together, these are called the activities of daily living, or ADLs. These are things that everyone does every day for a healthy life. But not all patients will be able to do these things for themselves because of illness or injury. Sometimes people are too weak to go to the bathroom on their own or feed themselves. And that's where you come in. If a patient needs help with any of these tasks, you will be there to help them. But not all patients will need help with all tasks. This is Henry. Henry had a stroke and has right-sided paralysis. And this is Martha. She had a left hip replacement. This is Bob. He has had a recent leg amputation. And Annie has dementia. and they will all require different care. Some patients will need help brushing their teeth, but others will do that themselves. As a CNA, we will help the patients do the things that they cannot do alone, but we will let them continue to do the things for themselves that they can do.
How will I know what I'm supposed to do with each patient?
I'm so glad you asked, Cassie. As the registered nurse caring for these patients, that's my job. When a patient gets admitted to our facility, I will do a head-to-toe assessment. I will review all body systems to evaluate the patient for real problems and potential problems. This is a very long, complicated process, but here's a brief overview of a general assessment. I'm going to look at his neurological status. I'm going to look at his cardiac status and his respiratory system. I will also look at his integumentary system, which is hair, skin, and nails, and his gastrointestinal system. His urinary system is important, as is his musculoskeletal system. And then I will review his endocrine, lymphatic, and reproductive systems. And finally, I will review the doctor's orders for this patient. I will use all of this information to determine the patient's real and potential problems. Here's an example to put it into perspective. Let's say that this patient has just had a right hip replacement. Now we know that she will need to continue her activities of daily living. She still has to eat, drink, go to the bathroom, bathe, groom, and dress. And after my assessment, I know that she did all of those things herself until today. However, she cannot get out of bed for any reason for the next 3 days. So, since we know that she must stay in bed, I have to figure out how to meet all of her ADL needs. The easiest way to evaluate basic needs is using the TEAMS method: toileting, eating, ADLs, mobility, and special. As the RN, I'll take all the information I gathered during the assessment to figure out the best way to help her. She can't get out of bed, so I have to figure out the best way to meet her elimination needs, bedpan or catheter. I also know she is at risk for constipation, since she's not moving much and she's on pain medication. This is a potential problem. She can feed herself, but the trays must be brought to her in bed. She can't sit all the way up because of surgery, but she can't eat lying flat either. She has dentures, so they must be within reach at mealtimes. And they must be cleaned daily. She's able to clean herself as long as the supplies are brought to her, but she can't reach her legs or feet, so she'll need help. She is on total bed rest for 3 days. And she also needs her dressing changed every day. You can see how the RN uses all the information available to create a plan of care specifically for this patient. This is called a care plan, and it's something that only an RN can do. Of course, this was a simplified version of the care planning process. A real patient's care plan is much more extensive. Every single aspect of her health, condition, and ability level will be evaluated in order to help her. Even the smallest decision can have long-term consequences. The RN will write a detailed care plan for the entire healthcare team to follow, and the care plan must be followed exactly.
So every patient will have a different care plan?
That's correct, Ben. Every care plan will be different because every patient will be different. Even patients that seem alike because they have a similar diagnosis or have had the same surgery may have differences in care. CNAs don't have enough education or experience to know all the differences. So as a CNA, your job is to read and follow the care plan for every individual patient. In fact, you could say that your job is to follow the care plan, the whole care plan, and nothing but the care plan. Do you think you can do that? Can you follow directions exactly?
I can.
Absolutely.
Sure.
Yes. Awesome. Then you're well on your way to being a great CNA. But helping patients with ADLs isn't all that you will do. You are also there to help the nurses by making observations. The CNAs are the hands and the feet of the patient. If the patient is cold and cannot reach their sweater, you will get it for them. If the patient can't brush their own teeth, then you will do that for them. If the patient can't get up to shower, then you will help them stay clean. You will become their hands and feet to help patients with things that they can't do themselves. but you are also the eyes and the ears of the healthcare team. You will report everything you see, hear, smell, or feel to the nurse. This is the most important task that you have as a CNA. If you see redness around a wound, you must report it. If you hear the patient wheezing after walking to the toilet, you must report it. If you feel that a patient's skin appears warmer than usual, you must report it. If you notice that a patient is coughing when eating, you must report it. As a CNA, you will be spending much more time with the patient than the nurse does. So you will be in a position to notice a lot more about the patient. The nurse needs this information to make decisions about the patient's care. Reporting these observations gives the nurse another assessment opportunity. That new assessment may even change the tasks you are assigned to perform. This is called the nursing process, and here's how it works. The RN assesses the patient and develops the care plan. This gives you specific tasks to do. While doing those tasks, you notice things. You report those observations to the RN, and the RN performs another assessment to review the changes in the patient. That new assessment prompts changes in the care plan, and this gives the CNA new tasks to do. And the cycle continues around and around as the patient gets better or worse. This is a continuous process until the patient is discharged.
I'm not sure I understand. Are you saying the care plan is going to change all the time?
Yes, it could, depending on the needs of the patient. Let me give you an example. The care plan told you to make an occupied bed in room 201. As you changed the sheets, you noticed that the skin on the patient's backside was red and irritated. You notified the nurse, who then reassessed the patient. The nurse decided that the patient needed to be repositioned every 2 hours around the clock. This was added to the care plan as another task for the CNA. Using this model, we can respond to the needs of the patient quickly as their needs change. But it also works for patients that are getting better too. You've been assisting Mr. Hopkins with transferring out of bed and into a chair after surgery. But you notice he isn't leaning on you any longer. You notify the nurse. The nurse reassesses the patient and decides that the patient can transfer on his own now. The care plan is changed, and this task is removed from the care plan since the patient is improving.
Doesn't this mean that I'm going to be bothering the nurse all the time? Won't they be annoyed?
The nurse should never be annoyed with you for reporting changes in the patient. They are legally liable for every aspect of that patient's care. Since the nurse requires that information to plan the patient's care, they expect to receive updates from you on the changes that you see. But how often you will have to report changes to the nurse will depend on the setting you are working in. Nursing home patients are pretty stable and don't really change all that often. That's pretty common for long-term care facilities, like nursing homes and ALFs and even home care. But in other settings, like hospitals, rehabilitation centers, and hospice, patients' health can change rapidly. In those settings, nurses and CNAs are going to work closely, and constant communication is required. Since CNAs must follow the care plan and are not allowed to alter it, they can't solve problems. The RN is ultimately legally responsible for the care of that patient. If you have information about the patient that you're not giving to the nurse, the patient can suffer, and the nurse is legally liable for that. Remember, you are an assistant. You are there to help, but the nurse is always in charge of the patient. So all changes, regardless of how minor they seem to you, must be reported to the RN. When the patient is stable, you will not have much to report and may go days without talking to the RN. But if you notice something, then it must be reported, even if you don't think it matters. If you aren't reporting observations, the nurse can't rely on you anymore. And if the RN can't rely on you, then you aren't a good assistant to that nurse. You must report to the nurse everything you see, hear, smell, or feel. Be a good assistant and report all changes and observations. This is the most important job you have. So the care plan is developed by the RN, gives the team tasks, CNAs follow the care plan, and report changes. Let's recap what we learned today. Can you tell me how a CNA knows what each patient needs?
The care plan.
As a CNA, you follow the care plan, the whole care plan, and nothing but
The care plan.
anything unusual that you notice about the patient, you must report it to
The nurse.
Great job. For the exam, you will receive a care plan. What should you do? Follow it exactly. That's correct. If you don't follow the care plan, you will fail the exam. It's that simple. Now that you understand the care plan, I can show you how the skills will be done for the exam. But remember, you must always read and follow the care plan. That's a big part of the skills exam. Take the brief quiz below to make sure you understand. See you in the next lesson. And it's not just the care plan, it's the whole care plan. I want to stop there for a second because what does that even mean? Well, what that means is that sometimes as CNAs, we tend to skip over things because we think that we already know what's required, okay, or what to do, or what a patient needs. And it's important to understand that every patient is going to be a little bit different. So let's say we have 3 diabetic patients, and diabetes is a relatively common disorder. And if you've treated diabetic patients before, you know that, there's certain things that we do, but that doesn't mean that those things are going to apply to every single diabetic patient we take care of. So we have to have a way of making sure that we're accommodating this patient's specific needs. How many of you guys have siblings from the same parents? Okay. So are you exactly like your siblings? I mean, absolutely. If you put you guys side by side, I'd never be able to tell the difference in how you think, you look, you act. Are you exactly the same? But you guys had the same parents, the same DNA mix, but it came up with 2 totally different people. Well, if we can have that among people that share DNA, imagine how many differences we would have with people that don't share DNA. Does that make sense? So we have to have that mindset that even though this patient may have a condition that we've treated before and we're familiar with, we don't know enough about this specific patient to make decisions. Good? Good. Okay. And then the last part of that is, and nothing but the care plan. And this is where your brain will get you into trouble every time, because your brain will automatically put a but or an unless at the end of that care plan. But what if this, or yeah, that would work unless the patient has this. Okay, your brain will do all kinds of backflips and throw stuff in there that doesn't belong. And it's important that you recognize that your brain has the ability to do that and work real hard on not letting that happen, because that's how medical mistakes get made. So the way this works is the RN does an assessment on the patient, looks at that patient top to bottom, head to toe, and they evaluate every part of that patient, not just what's going on with them now, but what went on with them before, what we expect to happen to them later, what their medications are, what their treatments are, what their surgeries are going to be, the expected outcome, other conditions they have that can play into that. I mean, there's so many things that have to be looked at here. And then once the nurse develops a plan, she's going to write it down. We call that the care plan. And that tells you what to do with that patient. Our job is very simple. We just read that care plan and do what it says. So if the care plan told you to help somebody brush their teeth while you stood on one leg, what would you do? Yeah, you would brush your teeth standing. You don't need to go to the nurse and say, okay, this is the weirdest thing I've ever seen, right? For whatever reason, the nurse has decided that action is what's required for this patient. I don't know why, but you know, you never know. So we follow the care plan, the whole care plan, and nothing but the care plan. Does that make sense? While we're doing that, though, we should be making observations. Now, observations are things that you notice, and it may be a smell. It may be the way the patient looks. It may be that they're weaker today, or they're not eating as much, or they're asking for the privacy curtain closed all the time. That's isolating them. Or they used to go to activities all the time. Now they're not going anywhere. I mean, these are all observations. And when your brain says, hey, this is weird, the person that should know about that weird would be the nurse. Because there may be a reason behind it, a medical reason behind it. If somebody isn't eating very well, they may be having a disease process going on that we need to get to the bottom of. If the patient is self-isolating, that could be depression, which will affect all other conditions. If the patient is weaker today than normal, then that could indicate maybe their nutrition intake isn't very good, or maybe they're not utilizing the intake that they're taking in. So there's some digging that nurse has to do with any change in the patient. This is the observation and reporting, the most important job that a CNA has, because otherwise we're just warehousing people and taking care of them. That's it. This part is warehousing people and taking care of them. This part is what makes you a caregiver. So an example of this is if you thought about a child, brand new baby, okay, just born, super dependent, relies on somebody for everything, can't do a thing for itself, right? And you send that baby home with its parents, and you cross your fingers and you hope, because we don't have any control over that. Now, which parent do you think would be more effective at growing a human to adulthood that is very well adjusted? Okay, we got two parents here. We have one that just feeds and changes the child. Pretty much it. Everything else, you're on your own. Or one that notices the child, learns its habits, can tell when something is wrong, and gets to the bottom of it before long-term damage can be done. Which child do you think is going to be more well-adjusted as they grow? Right, the one that learned the child and made observations, right? So the other one, yeah, we're keeping a child alive, but, not much more than that. And the long-term consequences of that are going to be pretty extreme for that individual. Does that make sense? Same thing here. Same thing here. If we have CNAs that aren't making observations, aren't learning the patients, aren't reporting those things, the long-term outcome for that individual is going to be pretty bad. Good? Does that make sense? Okay. So that's what we're there to do, is be the eyes and the ears of the nurse as we're doing these routine tasks. Good? So this whole thing is called the nursing process. And this is your part of it. Okay, there's 5 parts to the nursing process, and CNAs make up 3 of them. So we follow the care plan. We make observations, and we report those observations to the nurse. The nurse will then reassess the patient and change the care plan. So we play a huge role in the nursing process. They really should pay you more. I mean, it really is kind of that simple. They should pay you more. I don't set the pay rates, so don't come after me. All right. So this is the very first principle that we've learned. This is our very first banner that's on the back wall. There's 11 that we're going to learn, and we just learned the first one, and it wasn't that hard to learn. And we're going to go over it again and again and again throughout the program. I'm not going to let you forget this, but we're going to add some more on as we go as well. But just to make sure that we're all on the same page, go to page 20 for me. This is in your spiral book. And on page 20, you'll see 4 care plans. What do we do with care plans? We follow them. That's the easy answer. When I ask a question and I say easy answer, it's always the care plan. Okay. So what I want you to do, we're going to take 10 minutes on the timer. I want you to read the questions, refer to the care plan, and answer those questions. I'm sorry, 5 minutes on the timer. Get as many done as you can. I'm not collecting this. This is just for discussion purposes. Those of you playing along at home, if you don't have the book to be able to ask these questions on page 20, Jake has put in our crawler there how to get that book. Thank you, Jake. What's your name? Last name? There you go. You're welcome. Now, for those of you thinking it's too easy, that can't possibly be the right answer. They're trying to trick me. I can assure you they're not. The easy answer is the right answer. How many of you guys played Simon Says in grade school? Anybody play Simon Says? Do you remember that game? Simon Says. Yeah, it's a very simple game. Somebody is picked to be Simon and they say, Simon says, and then something. If you do that, you're still in. If they don't use the word Simon Says and you do it, you're out. This is kind of the same thing. The same rules of Simon Says apply with the care plan. You do what the care plan says and you do it quickly. So yeah, it is way easier than we think it's going to be. Okay, we'll go ahead and move on. Those of you who did not finish, it's okay. You can do this on your own time, but I do want to talk a little bit about these questions. So let's look at number 1 here. You received the displayed care plan. How far are we walking this patient? Why? Easy answer. Care plan, absolutely. Why isn't until they get tired the right answer? It sounds right, doesn't it? It sounds right, but what makes that not the right answer? because it's not what the care plan said. Yeah, absolutely. So do you see how easily, though, your brain can trick you with these questions? Because that seems reasonable, right? So let's go down to number 2. Now, if I had given you this quiz before we watched that video, before we started class, and I used to do that, by the way, most of you would have gotten number 2 wrong. So number 2 says you received the displayed care plan. What's required to assist this patient to stand? Most of you probably would have put a walker. So why can't we use a walker? Why can't we? Okay, say it loud. Yeah, because the care plan gives us our instructions. So what does the care plan say to use? Yeah, a gait belt or a transfer belt. So if you use any of the other options there, another caregiver, a Hoyer, a walker, you are out of compliance. Do you guys see that? I know this is a hard concept. I get it. Because your brain is right now going, yeah, but what if they're too weak to stand? Or what if I think they're a fall risk? Or what if? Remember that the nurse has assessed that patient and determined the right course of action for the patient. That's not for us to decide. That's for the nurse to decide. We're just going to follow those instructions. But wait, what if you truly think you're looking at the patient going, I don't know. I don't think he can bear weight, and he's way bigger than I am. And if he goes down, I'm in trouble, right? So what if that thought goes through your mind? Well, you're looking at the care plan. It says gait belt. You're looking at your patient and you're going, I don't know. You should stop and tell the nurse. The nurse is our final authority. Remember that we make observations, and then what do we do with those observations? Report them, right? That's not just for your patient's safety. It's also for yours. So we would go to the nurse and say, hey, listen, that guy is 6'4" and 260 pounds. And I don't think that my little gait belt is going to do the job here. I'm a little concerned. And then the nurse can let you know whether you're right to be concerned and let's make some accommodations, or, oh, this patient is fine, that he can bear weight. He just needs a little help with balance to stand up. Well, that's a completely different situation, isn't it? So if you have a concern, that's called an observation, and you would report that to the nurse. Can you just go grab a walker on your own? No. So that's the information I really need you to understand. We are not allowed to alter the care plan. We can't make those decisions. So as CNAs, it really is very simple. We only have 2 doors to walk through. We either follow the care plan or we notify the nurse. That's it. Those are our only 2 choices. We follow the care plan or we notify the nurse. Guys, how hard can this test be? You've only got 2 options. Follow the care plan or report it to the nurse. Does that make sense? Good. So I'm simplifying this down. We're going to build on this, obviously, but I'm simplifying this down to its most basic. This is the role of the CNA. Now we're going to build on that as we go. But we follow the care plan or we report it to the nurse. Make sense? Okay. So let's go down to number, let's go to number 5. Okay. 5 says you receive this displayed care plan. What is a safety concern for this patient? Anybody know what a safety concern might be for this patient? How do we know that? Yeah, because care plan told us. Care plan told us. Now, not all of your care plans are going to be this detailed. They're not going to say, hey, this patient isn't sitting up straight. You might want to make sure that that's a priority before you feed them. Not all care plans are going to do that. We are going to have to learn to do that on our own. But this care plan does. It specifically says, hey, they're not sitting up straight. Do something about that. So it's bringing our attention to that. Good? Makes sense? Does this patient need thickened fluids? What do you guys think? No. And the most important question here is, why doesn't this patient need thickened liquids? Easy answer. Yeah, care plan doesn't say it. We don't get to add that in. Does that make sense? Is this patient on a pureed diet? Why? How do I know that? Because it's not on the care plan. Does that mean that none of your patients will ever have a pureed diet? No, it means that this one right here, this meal doesn't have one. Doesn't mean it can't change later on. But this patient for this meal doesn't have one. Should we be encouraging fluids on this patient? Guys, it is so hot out there. Anybody been outside? It is like crazy hot out there. And we're in Florida, which is even worse because we get humidity as well. Horrible, horrible. Everybody needs to drink more fluid because we're all at risk of getting dehydrated with the amount of humidity and heat that we have out there. Does that sound pretty fair? So should I encourage fluids on this patient? Why? Easy answer. Care plan didn't say it. Care plan doesn't tell us to. Now, I just gave you a whole bunch of reasons why that might be a good idea, and your brain will probably do the same. Should you listen to your brain? Probably not. If we have a concern, who do we go to? The nurse. Because if you encourage patient or includes fluid on this patient, that patient is on a fluid restricted diet because they have advanced kidney disease, and you can overload them and kill them. But you think you're doing a good job. You think you're taking the right steps. You think you're making a good, objective, reasoned action, but you don't know enough about each one of your patients to make those decisions. Even something as easy as whether we offer somebody fluids can impact their health in a very big way because we don't know enough about that patient. Does that make sense? So we don't take any action unless it's been given to us by the nurse, either it written or verbally. We are an extension of them. Does that make sense? You now know everything you need to know to pass a state exam. And I'm not kidding about that. CNAs take no independent action. We do not engage in judgment, and that's per the state statute. That's a law. That is a legal principle. We follow the care plan. We work with the nurses. We help them. So you now have all the information you need to pass a state exam. So what are we going to do with the next 7 days and 3 hours and 10 minutes? What are we going to do with all of that time if we have all of the secrets that we need? Well, we're going to learn a little bit more about how to apply this knowledge. Does that make sense? But if you don't understand this, if you don't understand the role of the care plan, everything else that I teach you isn't really going to matter because you're going to try to apply that one principle to all patients, and that's not going to work for us. Good? Does that make sense? Okay. So let's go on to number 8. Now, number 8's a very special question. It says, how long do we need to count this for? So how long are we counting the pulse for? Why? Care plan says 1 full minute. Anybody know someone that works in healthcare? Anybody? Do you know someone who works in healthcare? Okay. If you know someone who works in healthcare and you go home today and you say, oh my gosh, do you know my instructor said that you have to count the pulse for 1 full minute? They're going to laugh at you and they're going to say, no, nobody does that. No, nobody does. We don't have, who has time for that? Nobody does that. And they're right. They're right. Because if our patient is stable and has a very rhythmic pulse, we don't count for 1 full minute. We count for 15 seconds, multiply that by 4 to get our full minute reading. It's a shortcut, perfectly okay to take. perfectly legal. No problem. Now, a lot of places don't even count the pulse. They use one of these. Looks like a little clothespin. It goes on the finger and it gives you readings with the pulse and the oxygen. This is called a pulse ox, and we use this for pulse rates way more than we count them manually anymore. And that is perfectly legal, perfectly okay. In fact, a lot of your policies and procedures will have you use a pulse ox. Perfectly okay. So, why is this question counting for 60 seconds? Why is that the right answer here? Why can't we multiply? It doesn't have it. Multiply by 4. Count for 15 seconds. Multiply by 4. Why can't we use that method? Because it doesn't say on the care plan. And you can't use that method if the pulse rate is irregular. If the pulse is irregular, then what I get in that 15 seconds probably isn't going to be the same amount as I would get in the next 15 seconds. And it's probably not the same amount I would get in the next 15 seconds. It's certainly not the same number that I would get in the last 15 seconds. So I have to count for that full minute. Does that make sense? We're not going to count until 60 because why? Why would you just stand there and count to 60? That makes no sense. That's not an answer. And until you get tired of counting, yeah, no, that's not how we take a pulse. So we're going to find the pulse. We're going to count for 1 full minute because our care plan told us to, and then we're going to write that reading down. Does that make sense? This pulse is the #1 failed skill on the state exam. So when you go take the state test, you are actually going to have to demonstrate a few skills. And we'll talk about that a little later in the program. But you're going to have to demonstrate some skills. And pulse is one that you might have to demonstrate. But it is the #1 failed skill on the state exam. And it's the easiest skill. So how does that happen? How do people fail this skill? Why? It's because they're not following the care plan. They'll count it for 15 seconds and multiply by 4. Or they'll pull out a stethoscope and listen to the heartbeat thinking they're going to get all fancy. Or they count for 30 seconds and multiply it by 2. Or they just make up a number, which happens way more than you would think. Scary. So a lot of people will fail this skill because they're not following the care plan. Guys, when you're taking the skills test, it's not about the skill. It's about the care plan. So if you aren't following the care plan, you're not going to pass the test. And that's why we have to spend so much time talking about this. Good? Make sense? Okay. So this concept is super important for CNAs. I've just spent the first hour talking about care plans. So if you look in your skill or in your yellow book, your homework book, now we know that this is an important topic. So look in the very back part of your yellow book. I think it's like on page 220 something. Look in the index for care plan. Look in the index for care plan. Once somebody finds it, tell me what page that's on so I can tell everybody else. 260? All right, so on page 260, you'll see care. Those are the definitions. Hold on. I didn't look this up. I'm sorry. So go to page, where is it? Yeah, care plan. Go to page 271. In the top little section there of the middle column, you'll see care plan. Now, we would expect the care plan to be on every page of this book, right? Care plan is pretty important. How many pages does this book talk about the care plan? All right, so let's go to page 7. And you'll notice that it starts on page 7 and then it just kind of moves over to page 8. It's not even like a whole big section. It's not a chapter by itself. It's one small Very small mention of the care plan. This is why I'm not a real big fan of this book. So what is your final authority on everything as a CNA? The care plan. Good? Makes sense? Because as you're reading this book, you could potentially lose sight of that because the book does not really explain to you the importance of the care plan. Everybody good with that? Good? All right. So on the state exam, you are going to receive a care plan set. Now that set looks like this. There's 11 of them that they're going to choose from. Actually, the computer chooses. So there's 11 of these, and you're going to get one of them. So can you give me a number 1 to 11? Okay, so the computer randomly picks skill set 8 for our CNA to perform, our candidate. So this is your care plan set. These are the 3 skills that you would have to perform that the computer picked for you. You are going to feed a resident, you are going to perform passive range of motion on the elbow and wrist, and you're going to assist a patient who needs a bedpan. These are your 3 skills. They're going to hand this care plan to you. They're going to read it to you because they can't even trust that you know how to read. They're going to read it to you. They're going to give it to you, and it is yours throughout the entire test. You can go back and look at this anytime you want to. In the middle of a skill, it's fine. You can refer back to this as often as you need to. Remember, we follow the care plan, so they give you access to the care plan. Good? So you know that you're going to have to do 3 skills. Wouldn't it be nice if you knew some of these care plans in advance? Would you want some of those care plans? Okay, well, here's 4 of them. These are the actual care plans from the state exam. If you get Pulse, if that's a skill that you have to do for the state exam, this is going to be your care plan. Okay, good? Good. If you get a range of motion to, where am I? Range of motion of the hip, knee, and ankle, this is going to be your care plan. If you get ambulate a resident, this is going to be your care plan. And if you get feeding a patient, this is going to be your care plan, which is actually one that we have here. Make sense? Now, that's just 4. We have to learn 20 skills plus hand washing. So do you want the rest of them? Turn to page 25 in your book. We're going to be all over this book today. All right, so page 25 has all of our care plan sets. All of these 11 are right here in your book. Good? Questions? Okay. So you always have access to this. But remember that these care plans are only for that one patient. Every feeding care plan you have is probably going to be a little bit different because your patient may be a little bit different. Let's say that we have 6 patients that we're feeding. One of them had a stroke with right-sided paralysis. So that care plan is going to have you putting the spoon with the food on the left side of the mouth, the part that still works. You may have another patient who has diabetes and gets insulin right before they eat. So they're going to have to eat on a very strict schedule. You can't put it off because that insulin that they were given will bottom out their blood sugar. So that patient, you're going to be told to feed first. Okay, schedules are going to be really important. We've got another patient who isn't eating very well. Like they're nibbling. And that's it. That's all we can get them to do. That care plan is going to tell you to encourage conversation and encourage intake. Another patient has Parkinson's and they shake really bad, but they can still feed themselves. They just need you to help cut up their meat and open their milk and, make sure everything is bite-sized for them, right? These are all feeding patients, but they're going to need a different level of assistance from us based on their needs. Does that make sense? Good. So remember that these care plans that you see on page 25 are just for the test. They're not going to be the same care plan you will get for every patient that you care for forever. Good. They're highly individualized. Okay, so how do we get these care plan sets, right? They have 3 skills on them. How do these get put together? There's a formula. So each one of these care plan sets, which you see on page 24, one of the skills is going to be an ADL skill. Remember we learned about ADL, right? Activities of daily living. These are things you do for yourselves every day, like eating or mouth care or making your bed or getting dressed or bathing, right? These are things you do for yourself every day. Activities of daily living. You will get one ADL skill. You are also going to get a documentation skill. Everybody gets a documentation skill. And documentation skills, there's 4 of them. There's pulse, there's respirations, there's feeding, and drainage bag. You're going to get one of those 4. Not maybe, you will get one of those 4. You will either be taking a pulse or counting respirations or feeding somebody or emptying a drainage bag. Guaranteed. One of those 4. And then we have mobility skills. Now, mobility skills are skills where we move the patient in some way. We turn them over on their side in bed. We get them out of bed and into a wheelchair. We take them for a walk. We do some range of motion. We're moving the patient in some way. So you're going to get one ADL skill, one documentation skill, and one mobility skill for the state exam. And they're bundled up in very specific bundles because it's all about managing time. Okay, it's all about managing time for the test. They don't want to give you 3 super long skills to do together. They try to balance them out. So these are our documentation skills. These are our mobility skills. These are our ADL skills. This is what I just talked to you about. I forgot to advance my slide. And these are what the care plan sets look like. Now, I've got them up here on my shelving unit for you guys to be able to look at. You've got them on page 25. And on page 25, in the upper corner, you'll see a little round clock with a time in it. 32 or 36, or it'll have a time in there. You guys see that? On here, on these yellow sheets, the time is down here. Here's our time, total time, but it tells you the formula we use to get that total time. And the formula is in your book. We'll talk about that a little bit later on in the program. But there is a formula they use to give you your time to do the skills. We do sell these. Remember, you have them in here for practice. You can use them. You have them on page 25 of your book. You can make your own. But if you want the laminated ones with the testing checklists on the back, then you see Jake. Oh, by the way, I forgot to introduce Jake. This is Jake on the, he's our wizard on the other side of the bookcase. And Jake runs all of my tech for me. He does all the administrative stuff. He ships out all of our products all the way across the country. And he's the one that you see if you want to order any of the additional learning aids that we have that we'll be talking about. You don't have to buy them. I'm not trying to talk you into them, but I do want you to know that they are available if you want them for study. And again, you have them on page 25 in your book. We also have a little pocket set that doesn't have the checklists. It's just the care plan, just this part of the care plan sets. These are what we call our pocket cards. And we do sell these for $5.95. I don't have them on my website or anything. You can see them up here. Yes. Okay. So we do have those available as well. Dorcas says, thank you so much. I passed my exams through your videos. God bless you. Congratulations to you. Great job. Great job. Welcome to healthcare. For those of you that don't know, we have the #1 CNA channel for CNA training on YouTube. So we are 170,000 subscribers and I don't know, like 70 million views or something like that. We're really big on YouTube. I don't pay attention to it, but we're really big on YouTube. And then this iPad over here that you see taping, this gives us our shorts that go on different social media platforms, just little snippets of what I say. All right. So we understand what the scope of practice or what we understand to follow the care plan, and that dictates our scope of practice. This is going to be on page 22 of your book. And you'll hear this term in nursing. I know I've got to compete, sorry. You'll hear this term, your scope of practice. Scope of practice is a legal term that dictates what you're allowed to do legally. And it's important that everybody in healthcare understands their scope of practice. Otherwise, we have dietary aides that are trying to run ventilators, right? You have to know what your lane is so you stay in your lane. Now, scopes of practice scope of practices are dictated by the state statutes. Okay? The government decides what certain people in healthcare can do, and then that passes down to your employers, to your nurses, and to you. Ours is dictated by something called the Nurse Practice Act. Now, what I need you to understand is that as a CNA, you will have relevant information, enough information for you to be able to do your job, but you are not going to have the whole story. The whole story. There's always a piece that a CNA doesn't know. And I'll give you a couple of examples real quick. And this is why it's so important that we follow that care plan, just because we don't know the whole story. So let's say we have a patient who the care plan tells us to get them out of bed and into a chair at the side of the bed. And they have to stay in that chair between 7 and 9 every morning. Okay. So the care plan is get them out of bed into the bedside chair, and they must stay there from 7 to 9 every morning. Now, you don't know why you're doing that. The care plan tells you to do it, so you're going to do it. But at 8:15, your patient hits call light and says, you know, my back really hurts. I don't want to sit up anymore. Can you please help me back to bed? Are you guys helping them back to bed? Why?
He's got to be there from 7 to 9.
Okay, and it's 8:15. So that means that it's not 9 o'clock. So we can't help them back to bed. Should we say, sorry, out of luck, you got to stay where you're at? What should we do with that? Report it to the nurse. That's right. So this particular patient, if you got them out of that chair and put them back to bed because you felt bad for them, I'm so sorry, your back hurts. Let me help you. Right? We're all here because we want to help patients. If you had done that, there's a part of this story you don't know. This patient takes a medication that can literally burn a hole in the esophagus. The tube that goes from the mouth to the stomach can burn a hole in that esophagus. And if you lay the patient down, then the pill, as it dissolves in the stomach, is going to float up to the esophagus. We can actually burn it. So we want this patient upright so that gravity keeps the pill down in the stomach where it's safer. But if the patient asks, can I go back to bed? And you put them back to bed because you feel bad for them, you have just increased their likelihood of injury. Good? Makes sense? Now, let's take that just one step further. Let's say that you have this patient, they say they want to go back to bed, you know the care plan says, and you say, oh no, you just need to stay in that chair. I'll come back in 45 minutes and get you back into bed. And you don't report it to the nurse, you just handle it. Well, that backache that they were complaining about was from something called a retroperitoneal bleed, which means they were bleeding internally and that blood pooled in their back because of their position, and they ultimately bled out internally. So bleeding internally can happen spontaneously in some patients. If their aorta ruptures, if they're on blood thinners, if they had an injury that wasn't reported, like they can be bleeding and we wouldn't know it. And the only clue that we have is They say their back hurts. Now, as a CNA, you think, yeah, you're old. Everybody's back hurts when they're old. I'm not going to worry about it. That's nothing to report. Stay in the chair. I'll put you back in bed at 9. We've just missed a huge clue. And it might cost this patient their life. So it's really important that we understand our scope of practice, to follow that care plan, and to report everything that we notice to the nurse. Now, one of the things that when we're talking about reporting, right, one of the things we have to talk about is all of our senses, because you gather information not just through your eyes. You gather information through your ears. This patient said their back hurt. That's an observation. You gather information through your nose. If something smells funny, different than normal. So if you walked into a patient's room and you smelled grape Kool-Aid, and they're in a facility, we're not serving grape Kool-Aid, but you can smell grape Kool-Aid. Look around, don't see any grape Kool-Aid anywhere. What is that? Well, you're likely to dismiss it and think, oh, it's no big deal. It's just, a drink, apparently. I'm not going to worry about it. Well, that scent, that grape Kool-Aid-like or grape jelly-like scent, can actually herald or indicate a Pseudomonas infection. And Pseudomonas infections can be extremely hard to control if we catch them late. One of the first signs is the smell of grape Kool-Aid. So if you walk into a patient's room and you look around, you see nothing purple, but you're smelling grapes, that's something you should be reporting to the nurse. But you probably would just kind of dismiss it, right? Every observation you make, no matter how minor it seems to you, needs to be reported. So everything we see, everything we hear, everything we smell, even things we touch, if the skin feels colder than normal or warmer than normal, or sandpapery under our hands or whatever, anything that we notice must be reported to the nurse so that they can take additional assessment opportunities. Make sense? Try not to use taste, though. That's the one sensory organ we don't have to use. Everything else, though, you should be using. Any questions so far? So this page, page 22, gives you a couple of scenarios that will help you understand why following the care plan is so important. And it shows you some instances, some considerations that you as a CNA may not be aware of that could actually put our patient in jeopardy if you're not following the care plan. Okay, good. All right, so let's go to page 13, and we're going to talk about the 5 key phrases. And this is probably one of the things I'm proudest of creating. Now, everything that we use in this class, I have created myself. All of our principles on the back wall, all of the videos, they're all done by me. I've created this whole program from scratch. I've been doing this for well over 20 years, and I get easily bored, so I create stuff. I'm very artistic. I also write fiction in my spare time. So this is probably the thing I'm most excited about creating, though, because it really does keep you from getting yourself in trouble somewhere down the line. So let's talk about this graphic here. Let's talk about this. This is called our scope of practice, or our happy CNA place. This is what's going to keep us safe from legal prosecution. It's kind of important, isn't it? So we're going to form a foundation of the care plan, the whole care plan, and nothing but the care plan. As long as you are following the care plan, you have no liability. The nurse makes the decisions about what we're going to do. We followed those instructions. The liability is on the nurse. Good. We don't like liability. We want somebody else to have that liability. So if a mistake gets made, it's not us. It's the nurse. Nurses are legally liable for everything you do. The people with the license are the ones that are liable. CNAs are certified, no liability there, unless you're outside of your scope of practice. So it's important that we know what our scope of practice is to limit our liability. Good? Make sense? Okay. So we are going to follow the care plan, the whole care plan, and nothing but the care plan. We've got that firm foundation. We already know all about this. I talked about it for an hour. Let's move on. But we need some things to keep us firmly centered. We're going to stand on that care plan, yes, but we need some things to keep us from kind of going out on our own, right? We need some firm guidelines here. And one of those is CNAs do normal. That statement, CNAs do normal, is extremely important for you to understand because it really, how do I put this? It will keep you centered where you need to be, okay? So what does that normal mean? Normal is a routine task, okay, on a stable patient that you have been trained to do according to the care plan. Routine task on a stable patient that you've been trained to do. So what does that mean? Well, it means that CNAs aren't going to be working with a crashing patient in an ICU setting, trying to figure out what meds to give and what lines to put in and what our next step is. And we aren't in those situations. We do routine tasks, things that you can do with your eyes closed and half asleep, routine tasks. But the other part of that is they have to be on stable patients, because if your patient isn't stable, things are going to happen. And when things happen, somebody has to respond to that. Well, you're the one with the patient and you aren't allowed to create tasks. So now you're making judgments. Make sense? So routine tasks on stable patients. Now, the third part of that is things you've been trained to do. YouTube is not training. It can be part of a training process, but it in itself is not training. You can't go home and look up how to remove a gallbladder. And there are videos on that. There are. And watch it a couple times and then decide that you're going to go out and take somebody's gallbladder out because they're complaining of, indigestion. That's not really something that we can do. It's outside of our scope of practice because we have not been trained to do that. Does that make sense? Good. Okay. So normal is a routine task on a stable patient that you've been trained to do. And we're always going to default to the care plan. Did the care plan tell us to do this? So let me give you an example that will make it a little more real. What's your name? Teresa. Teresa, let's say that you go to work in a same-day surgery center and you go to work in pre-op. You're getting patients ready for surgery. So you're telling them, take your clothes off, put on this gown, go to the bathroom, empty your bladder, put your stuff in the bag, we'll inventory it to make sure nothing goes missing. You're doing all that, right? Getting them ready. And that's all a routine task on a stable patient. You've been trained to do that in your facility and your preceptorship. So you're good. You're covered. That's fine. And let's say, what's your name? Delilah. Delilah goes to work the exact same place. And you go to work in post-op. So this is after the patients have surgery. And you're helping them. Their catheter has to come out. Their IV has to come out. You've got to get them dressed and make sure that they can stand and walk to the car to go home, right? You got a lot of stuff to do, but you also have to make sure that they pee before they go because the catheter just came out. And yeah, most of the time you have a catheter during surgery. So you work at the same place, the same shift, but you have completely different tasks than you do. Same title, both CNAs, same place, working with the same patients, but you have different tasks to do. Now, does that mean that you can do her tasks? No. Does that mean that you can do her tasks? No, because you have not been trained or told to perform those tasks. Now, she's got to have some extra training because I'm actually going to train her to take those catheters out. Very routine task. Our patients are stable. We're sending them home in like 3, 2, 1, right? So our patients are stable. So I can train you to take a catheter out. It's perfectly okay. So you work there for a couple of years and you decide you want to move on to brighter horizons and you go to work at a hospital. Now, you know how to take IVs and catheters out. Great. You walk into a patient's room, you know that they're being discharged later that shift, and you figure, well, I'm here, I'll just go ahead and take the IV and the catheter out. Can you do that? But you know how. It's a stable patient. It's a routine task. You've been trained to do it. Why can't I just walk in and take it out when I know they're being discharged? Ah, we're missing a component, aren't we? We're missing the care plan. Good. Does that make sense? Good. Now, as the nurse that is working with all of you, I have to understand that each one of you has a different skill set because you know how to get somebody ready for surgery. You know how to take care of somebody after surgery, and you worked in a mother-baby unit and you can swaddle like there's no tomorrow. Okay. You all have different skill sets. I can't assume that everybody has the same skill set. So if I need you to do a task, I may ask you, hey, do you know how to take catheters out? And if you don't, you need to be honest and say, no, I have not been trained to do that. But you should be open to additional training. Now, training can be in a classroom, but it can also be at the bedside. I can ask you, well, come with me, and I'm going to show you how to take a catheter out. It's super easy. You put the syringe here, you pull the water out, it slides right out like limp spaghetti. Super easy, okay? No pain involved. So I may show you how to do that because it's a 1, 2, 3. I can watch you do it. I'm pretty satisfied you can handle this on your own. If you have any problems, come let me know. But these 3 patients, go ahead and take their catheters out. They're getting ready to go home. I can train you. It can be at the bedside. Good? Make sense? But just because you've been trained to do something doesn't mean that you get to apply that on anyone that you haven't been told specifically to do it on. Does that make sense? Are we good on that? Okay. Now, so that keeps us kind of in boundaries. The other side is our principles. Oops. Okay, hold on. The other side are our principles. These are the things that we're going to be learning in the class. They're all along our back wall. There's 11 of them. We are going to learn these as we go. And I'll talk a little bit more about this. But this tells us how our rules around the skills that we're going to be doing. So these are the rules on how to do these skills. Care plan tells us what skills. This side tells us who we can do those skills on and who can perform the skills. This side tells us how to do the skills. We're going to learn that as we go. And then above all, above everything else, it's always about the patient. Never forget who we're working on and why we're doing these tasks. It's about the patient. And something that most people don't understand is during the state exam, when you go take the state exam, you think that you are the one being graded, that it's all about you, right? They're going to pass me or they're going to fail me. I'm the one being tested. It's all about me. And the reality is it's actually not. It's all about the patient. It's how you make the patient feel while you're doing the steps. It's how safe you keep the patient while you're doing the steps. It's how you communicate with the patient so they know what's coming while you do the steps. Does that make sense? So every single checkpoint that we're going to look at, and we look at every checkpoint for all the skills as we go through this program. As we look at every checkpoint, they are always about the patient. And if you can make that change in your brain, if you can figure out, hey, this isn't about me, it's about the patient, then you will do very well on the state exam, very well, because that's where the evaluator's focus is. So a common mistake that's made on the state exam is that CNAs will do extra. So you get range of motion exercises, right? These are just simple exercises you're going to do, elbow, wrist, super easy exercises. But you think in your mind, I want to impress that evaluator. Now, our care plan told us to do flexion extension on the elbow, flexion extension on the wrist. And we think, I want that evaluator to know just how good of a CNA I am. So I'm also going to do rotation on the wrist. And maybe I'll work on the shoulder too while I'm here to show her that I know what I'm doing. Well, what you've actually showed her is that you don't know what you're doing because you did not follow the care plan. So you leave the test and you think, I must have aced that thing because look at all the extras I did. And you're shocked when you get your results and find out that you failed because you didn't follow the care plan. Good? Does that make sense? Okay. So be very, very careful about adding to or taking away from that care plan on the state exam. And your brain will talk you into it. It will. Your brain will talk you into stuff. Try to remember that we want to stick to that care plan 100%. And while we're doing that, we want to remember it's always about the patient. One of the ways that I do this is that I pretend that my patient is a beloved family member or friend with every patient I go into. And I have a couple in my little Rolodex in my head that I just immediately default to. If it's an older gentleman, then we'll call him Cliff, okay? And I'm going to treat him like I would treat the Cliff in my life. If it's a middle-aged woman, I'm going to think about my aunt, okay? Somebody I like. So if you treat the patients like they are somebody that you like and respect and want the very best for, your communication with them will take care of itself. Is that good? Make sense? Communication is a big part of it. So imagine for just a moment, that you are in a strange place, not home. You are surrounded by strangers. You don't know a single soul here. You're not dressed for company. You're wearing a hospital gown and footies and not much else. You've got a roommate that you didn't sign up for that probably turns TV up too loud and snores at night. Okay. And you're scared to death about whatever's happening to you. And then somebody that you don't know who's dressed in scrubs walks in the room and puts their hands on you and you don't know what they are intending to do. How are you going to react to that? Yeah, you may get very fearful or defensive, or if you're like me, I'm hitting first and asking questions later. Because I am not dressed for company and I don't know, and you're putting your hands a little too close to my dangly bits, right? So we haven't been introduced. And the problem is a lot of times with CNAs is that we get so ingrained in our day-to-day routine and we think to ourselves, I've seen them all. I don't really care what yours is, right? And we adopt this attitude where it's just another day at the office. And we have to remember that with this patient, it is not another day at the office to them. Does that make sense? So if we can remember that it's always about the patient and we can treat that patient as if they are a beloved person of ours, your communication gets really easy. Okay, good? Okay, the other thing that we have to remember is to report all observations. I've talked about this at length. It's 2/3 of our job. We already know this, but remember that that really is the top of everything. That's why we're there. That's why we're there. And if you have an observation and you don't report it to the nurse, that patient isn't going to get the care that they need. Good? Okay, so a question I get asked a lot is, am I allowed to do that? Insert something here, right? Am I allowed to do that? And the answer is not as cut and dried as yes or no. you have to figure out, first of all, whether it's allowed by the state. Now, here in Florida, we're pretty much wide open. Okay, our Nurse Practice Act, Section 2 that governs CNAs, it's basically whatever the nurse wants to train you to do, you can do. We're good. It's not restricted. Now, that is not the case in every state, though. There are some states that are like, oh, no, no, no. CNAs cannot take blood pressures. We don't trust y'all. And we adjust medication based on your reading, and we know you guys are making up numbers. So in some states, CNAs are not allowed to take manual blood pressures. You can use machines, but not manual. In some states, they're like, CNAs have no business around catheters. We're going to take that off the table. Not an allowed skill. So if you decide to move from Florida to another state, you probably ought to look up the Nurse Practice Act in that state and find out what CNAs are and are not allowed to do. Make sense? That's information you really should know about your own practice. But I get it. State statutes are kind of hard to read. They're like legalese. You got to wade through all those big words, right? So your next step is your employer. Because if our patient, let's pick on this lady here, if we do something wrong and our patient decides to sue, they're not suing the CNA. You don't have anything. You're making like barely above minimum wage. You're driving an old broken down Corolla, right? You probably still live with family. You don't have anything to take. They're not suing you. They might get a little more out of the nurse, but the nurse doesn't make much more than you. So, they don't have much to take either. Do you know who they're going to sue? The facility. That's right. Because the facility has insurance and deep pockets, and we can get some pretty decent money out of that. So they will sue the facility. So who's the one really that absorbs all the risk for what you're doing? Your employer. Okay, make sense? Everybody with me? All right, so that employer is going to determine what they're okay with you doing to manage that risk. Here in this facility, we don't want our CNAs taking out catheters or IVs. That's too big of a risk. We don't like that idea, so we're going to make our nurses do that. So your facility will have policies and procedures that dictate what each type of person, each modality can and cannot do in that facility. And that's to help limit that risk. Does that make sense? So we have our state statutes that govern this, and then the employers adhere to the state statutes and further define what their CNAs are and are not allowed to do. Then under the employer is the nurse. Now, I am legally liable for everything that you guys do when you're working with me. So I have to have some assurance that if I tell you to go in and brush that patient's teeth, that you're going to do it exactly the way I ask you to do it and not like make up your own stuff, right? Does that make sense? If I don't feel comfortable passing on that risk, I may have to do all of those tasks myself to make sure that I'm not in a liable situation. So if you want your nurses to work with you, you've got to be good CNAs and listen to the nurses. Does that make sense? Good? Okay, so along the way, we're going to have situations where your nurse is going to want to train you to do something. I want to train you to swaddle babies. You're working in a mother baby unit. Let's train you to swaddle. Well, that nurse has to make sure that it's okay with their facility and it's okay with the Board of Nursing or the legislation for me to be able to train you to do that. And then I would come to you and I'd say, do you want to learn how to swaddle? I think that you follow directions great. I'd like to train you on this. You're going to say yes, because the more skills you have under your belt, the better you are. You're going to say, yes, we're going to train you. And then from then on, you can do that skill only when you've been told to do it by the care plan. Good? Make sense? Now, Remember we talked about just a few minutes ago, it has to be a stable patient, right? A routine task on a stable patient. So a lot of brand new CNAs, they want to work in the mother baby unit, or they want to work in NICU with the itty bitties, or they want to work in an ICU setting, or they might want to work in the ER. Do we find stable patients in those places? No. So the opportunities for CNAs in those settings, particularly brand new CNAs in those settings, is actually going to be kind of low. Those opportunities are going to be few and far between because we don't have stable patients. That doesn't mean that ICUs don't have CNAs. They do. But in most cases, they're going to want you a little bit seasoned before you take on those higher levels, because those patients aren't stable, which means that you might have to make some judgment calls. And as a brand new CNA, that's a scary place to be, because if you make the wrong call, it could really affect our patient. And I'm the one that's liable for that. Does that make sense? So don't be disheartened if you're not seeing those opportunities in your job searches. If you really want to work in the NICU and you're not seeing those job opportunities out there, get in at the hospital, prove yourself, and then when those opportunities come, you're much more likely to be a good candidate for them. Does that make sense? Now, the nursery, CNAs used to work in the nursery, because feeding a baby, very routine task, and not the NICU, just the regular nursery. Your patients are pretty stable, right? So CNAs used to work in the nursery. But unfortunately, sometimes accidents happen and babies fall. And your nurse is the one that's liable for that. So those opportunities just aren't going to be as, you're just distracted for just one moment. Just one moment. That's all it takes. And even nurses fall prey to this. Did you guys hear about the NICU nurse? Oh my gosh, this was heartbreaking. This baby, a teeny tiny baby, already had health problems, was hooked up to a monitor in a NICU. The nurse went in and took the little monitor box and put it in her pocket while she was holding the baby and taking care of the baby and changing the baby. And, and then she went to walk away. And she still had the monitor box in her pocket that was attached to the baby. And it pulled the baby, and the baby fell and died. Yeah. So these things do happen. Do you think that makes the baby's parents any more comforted? Because when you leave your loved one with a stranger, you have to have some assurance that that stranger is going to take just as good care of your loved one as you would. And that, a lot of times, is what's going to fall on the CNA. Take as good of care of that person as if it were your loved one, because that is somebody's loved one. But those types of situations are what dictate, in a lot of ways, the laws that determine where you can work and the tasks you can perform. Okay, good. That's heartbreaking to me. Heartbreaking. I can't even imagine. So the answer to this question, am I allowed to do that, is, I don't know. Is it on the care plan? Is it a routine task? Is the patient stable? Have you been trained to do that? If the answer is yes to all of that, sure. Go ahead. Good. If the answer is no to any of that, no. Okay, good. All right. So what we just talked about was delegation. All the notes for everything I just said is on page 14. I'm not going to go through that. And we talked about our liability and remaining in our scope of practice, which is on page 15. So we've already been through that. So let me talk to you a little bit about the patients themselves. When you are sick, anybody ever been sick? When you're sick, where do you want to be? At home, your home specifically. not anybody else's. You want to be at your home because that is your comfortable, your little nest, right? It's where you're most comfortable. You want to be around people that you know, that you trust, because now you're vulnerable. Does that make sense? So if one of you got sick in this classroom right now, you'd be bowing out going, sorry, I'm going home. Even though I'm a nurse, you would be like, gotta go, going home. So the one place that we want to be more than anywhere else when we're sick is home. The patients that we're caring for the most part, are they at home? No, they're at somewhere else. Where do they want to be? So they're already grumpy. Do you guys get that? They want to be home. Now, this gets really complicated if we're talking about a nursing home situation or an assisted living, because that is now their home. Congratulations, you have a new home. And those cost so much money, we're going to make you sell your home so you'll never get out. This is a one-way door. You come in, you don't leave. So we got a person that wants to be at their home, but they've had to sell their home to be able to afford the health care. So that means that this is now their home. Do you think they're happy with that? No. No. So we've already got somebody that wants to be home, and we got somebody who's had a material deficit to get the care that they need. So we're not starting out on even ground here. All right. So the next part of this, we kind of have to think about the patient themselves and their mindset. If somebody is in a hospital or a rehab or even a nursing home, chances are they're probably thinking, I'm dying. What's wrong with me? And they're very, very self-absorbed. What is this going to mean to me? And I see two of you right now have injuries, right? And you're thinking to yourself, when you got those injuries or whatever caused them, you are thinking to yourself, how is this going to affect me? Am I going to be able to drive to class? Am I going to be able to write or to wash my hands or, whatever it is, because you have an injury? You are thinking about the effect of that illness or injury on what is happening in your life. You are self-absorbed. You're supposed to be. Good. Patients in facilities are often medicated, which is going to have an effect on how often they have to go to the bathroom, how much they eat, how tired they are, their mental acuity, how sharp they are. These medications are going to affect a lot of different parts of them, and they're going to feel different, not normal for them. Does that make sense? So are we dealing with somebody on their best day? No, they're in a strange place, not home. They're surrounded by people they don't know. They've got a health concern going on that's making them very self-absorbed. They're medicated, which is changing every part of how their body works, and that can be so frustrating. They're concerned about the financial and emotional impacts of this, and they're probably wondering, who's going to feed my cat, or where is my significant other while I'm in here? They got a lot going on. Does that make sense? Now, anybody in here ever been to a hospital overnight? Anybody been a patient at a hospital overnight? Do you know what is the one thing you need to heal and get better? Rest, sleep. Do you know the one worst place on the planet to try to get that rest and sleep? Yeah. So those two things don't go together, do they? Right? Our patients need rest, and we're going to go in every 20 minutes. On average, about 17 different people go into a patient's hospital room every 24 hours. You've got nurses, at least one for each shift, and probably a charge nurse. You have CNAs, you have phlebotomy, you have EKG, you have dietary, you have x-ray, you have transporters, you have billing clerks. Those hurt the worst. You have the doctors, and you have volunteers that come up and deliver newspapers and flowers and things like that. That's a lot of people in and out of that room. Your patient is not going to sleep all that well. What happens to your mood when you're sleep deprived? Oh my goodness. So we are not starting out on a good foot here. Our patient is not our smiling, sweet, grateful individual that we expect them to be. That's what we think, right? We've watched Grey's Anatomy. We've watched Scrubs. We know our patients are all wacky and goofy, but fun and smiling and grateful for our assistants. And that could not be further from the truth. Your patient is sleep deprived, grumpy, wants to be home, self-absorbed, and just overall is over it. So if you have a nice patient, that is an exceptional day. That put a smile on your face. That is amazing. That's awesome. But more often than not, your patients are going to be experiencing things that you are not even aware of that's going to influence how they relate to you. So we have to understand that we're going to meet them where they are. And we are going to bring the smiles and the joy and the caring that they need from us. So even though our patients may have bad attitudes, that's no excuse for us not to have a good one. Does that make sense? That's part of what we are being paid for, is to bring that sunshine into the patients who are horribly low on it at the moment. I have a theory for this. It's called the bucket of nice. I think everybody is born with a bucket of nice. You're born with one. And when you're little and as you grow, people fill your bucket up for you, right? Mom is nice, grandma's nice, right? You get friends, you grow, you get a bucket of nice and it gets full. And then as you go through your life, you give some of your nice away. A friend is down, they just went through a breakup. You give them some of your nice and you cheer them up. You hold the door open for a stranger walking in a store or something, and you give some of your nice away. But that's okay. We can give some away because we're getting nice refills from other people, our friends and our family, and our bucket stays pretty full. But as we age, as we get into our older adult years, we're not getting as much nice given to us. And if we keep giving our nice out and we're not getting refilled, what's going to happen to our bucket of nice? It's going to become empty. Now, we walk in as CNAs and we work with that patient, and that patient isn't nice. And we think that's a them problem. Do you know what kind of problem it really is? It's an us problem because we're not giving them enough nice to fill their bucket so they can give it back. Does that make sense? So the hardest to deal with patients often require the biggest nice infusion to get them easy to work with. Now, I'm not going to tell you that everybody can be rehabilitated for their niceness. It doesn't always work that way, but that still shouldn't stop us from being nice. The maddest I've ever gotten at a CNA that I worked with was a CNA who came up to me and said, well, she started it, and pointed to a patient. It's the maddest I've ever been at a CNA because that patient isn't being paid for their attitude. You are. Good? Good. It's not just about knowing how to do the skills. It's the way we do those skills that's really going to determine whether you are going to be called a good CNA or a not so good CNA. And we've all seen not so good CNAs out there. We have plenty. We don't need any more. So part of what I have to teach you is how to set yourself apart, how to be that good CNA. Good? Questions? All right. We talked a little bit about this. This is page 23, differences count. Remember that every single one of our patients is going to be a little bit different, and we can't treat them all exactly the same. Great example of this was my grandmother. Love her to pieces. She's my Grammy. Love, love, love my Grammy. But I was a hospice nurse and she was on hospice. She had congestive heart failure. She lived with my mom in a little apartment, and she was very particular about certain things. And when I went to see her, I saw her as a granddaughter, not a nurse, because you can't be a nurse and a family member at the same time. Just doesn't really work out well. So I went as her granddaughter, right? Not her nurse, but remember, I was a hospice nurse. So I dealt with congestive heart failure patients all the time. I could tell you medications. I can tell you oxygen flows. I can tell you that when they start to hallucinate, lay them down. That way the blood gets to the brain, doesn't have to fight gravity, and their hallucinations often will go away because now they're getting oxygen where they need it, right? I can tell you all of this, but do you know it was a little bit different when it came to my grandma, right? I looked at this a little bit differently. And the reason I looked at it differently is because she was different than my other patients. They were all individual. So my grandmother did very, very well laying down when she started to hallucinate a little bit and get the oxygen back to her brain. And then she could sit up and she would play solitaire until dawn. She was good at computer solitaire. It's the only game she played, but she was really good at it. But then she got shingles, and the shingles, actually, the nerve tract went into her eye and she lost her vision in that eye. So now she can't play solitaire on the computer anymore. And that's really the only thing that she had. She couldn't really watch TV. So now she's like super bored. And do you know what super bored people do when they're super bored? They invent things for other people to do. And she drove my mom absolutely nuts. Absolutely nuts. Now, the recommendations I made to my mom about this situation were a little bit different than recommendations that I would make to other people who were experiencing a same situation, because the patients themselves are a little bit different. My grandmother, CHF, on oxygen, with shingles and blindness, right? How I'm going to handle her need for recreation is going to be different than you with CHF, who only needs oxygen when you are involved in physical activity, right? And you have your full vision. Do you guys see how every patient, even both have CHF, but every part of that patient is going to have to be taken into consideration? And this is why we have to remember that every patient is different. Good? Okay. We're going to go ahead and take our break. We take 15 minutes. So there's drinks in the refrigerator. There's coffee machine back there. The bathroom is in the back. There are snacks. The creamers are in the refrigerator, and we'll take about 15 minutes. I'm going to put it up on the screen. Zero. We'll start again. All right. We're going to shift gears a little bit and talk about the state exam now, what to expect, how it's structured, all of those types of topics. Everything I'm about to tell you will be on page 12. Our closest testing center to us is in Tampa. It's right around the airport area. So if you go down the parkway, it's not too far. If I have anybody from Citrus County, Ocala might be closer for you, just kind of depends. But there are none in Hernando County. There's none in Pasco County. There's none in Citrus County. We have to go to a larger metropolitan area for our testing center. When you go for the testing center, Jake, am I unmuted? Okay, thank you. When you go to the testing center, the only things that you can take in with you is your test admission letter if you printed it. If you didn't print it, no big deal. You don't have to print it. You can take your keys and you can take 2 forms of ID. One must be a government issued photo ID, like a driver's license, state ID card, or passport. The other is a signed ID. So your social security card would work, a debit or credit card would work, a library card would work, just something with your signature on it. But the names on those 2 IDs have to match. Okay? They have to match. You cannot take study material in. You cannot take electronic devices like cell phones or tablets or anything in with you. Just these items. That's all they'll let you take in. If you did not drive and you can't leave your stuff in the car, they do have lockers there. So you would have to lock up your items and wait until the end of the day to get them back. I recommend, if you can, driving and leaving your stuff in your car, and I'll explain why in just a couple minutes. Okay. When you go into the testing center, they're going to check you in, and they're looking at a couple of different things. They're looking at your IDs to make sure that you are you and you're not testing for your cousin or something. They'll also kind of do an up and down on you just to see, you know, kind of who you are and all of that. So you want to look good. You want to look professional. Don't show up in a bikini top and cut off shorts. There is no dress code for the test. You can wear a bikini top and shorts to test. I don't recommend it. The only dress code requirement is closed-toed shoes. So you want to wear something that covers the feet like you were going to work, but there's no other type of dress code. But I would suggest looking professional. Good? Good. So after they check you in, you're going to be seated in a waiting room with 7 other strangers. You will not be testing with the people in this room. Everybody registers independently. You will get your own test date. Everybody moves through the system at a different pace. So you won't be testing with people in this classroom in most cases. So that means you're there with 7 strangers. And you have nothing to distract you. You have no phone. You have no electronics. There's nothing to do. Be careful about making friends on test day. What I've seen happen during the waiting period, you know, after you get checked in and you're sitting there waiting. We were a testing center for many years. And what ends up happening is, oh my gosh, I'm so nervous. I'm so afraid I'm going to fail on something stupid like hand washing. Like, I can't remember. I mean, 10 paper towels is a lot to count. So what if I get confused and only use 9? Are they going to fail me on that? And you're sitting there thinking, what? 10 paper towels? Nobody told me about 10 paper towels. What are you talking about? So you're going to ask them questions and they're going to give you answers. And then you're going to say, that wasn't how I learned. And they're going to say, well, what did you learn? And you're going to say, well, nobody's counting paper towels. Nobody cares. You just can't touch the areas that aren't clean, right? So you now have 2 completely different experiences. And then you got a third person chiming in. Well, that's not what we were taught. So now this waiting room has become stress soup. Everybody is all stressed out over who was taught right. So the first thing that I want to explain to you is that there are a lot of roads that get you where you want to go. Okay. How many of you guys have ever cleaned a house? Okay. What room do you start with? Okay, kitchen. Bedrooms. Anybody bathroom? Okay. Okay, top to bottom. All right. What's the right way? There isn't one, right? As long as we get the right results and we're all like not drinking bleach along the way, right? There are some rules that, that govern this. We don't mix bleach and ammonia because you don't want mustard gas in your house, right? So there are some rules that we have to follow, but there is no hard defined step by step that everybody starts at the same place, does cleaning the exact same way, and ends at the same place. It's your house. Do what you want to do, right? But we're going to end up with the same results. We're going to end up with a clean house. Doesn't matter how it gets done, we end up with the same thing. The test is like that. The state understands that you may have a completely legitimate workflow that works for you. It abides by the rules that we have to abide by, but you may do the skill a little bit different than you do, and that's okay. You may do the skill a little bit different than you do, and that's okay. There are a few steps that are going to be important, the sequencing, and I'll get to those when we get there. But for the most part, as long as we get the right results and you followed the rules, we're happy. Make sense? Good. So when you're sitting in that waiting room and you are listening to everybody say all of the different ways that they learn, don't automatically think that yours is wrong. There are a million ways to get these skills done, but we do have to abide by the rules. Now, the rules are the things on the back wall that we have to learn. And number one is follow the care plan. Okay, so we got rule number one down. Good. But try not to make friends here. Okay, because if you tell somebody, oh, hey, listen, I actually went to Miss Patty's CNA class. I sat in her classroom and she said that paper towels don't matter. Doesn't matter how many you use, just don't touch areas that aren't clean with the paper towels when you're drying. Well, when you say that, and you'll be right for sure, you've now introduced confusion into somebody else. And if they fail, they will blame the last person that they heard from, which happens to be you. And that's a lot of responsibility on you. They have no right to blame you. You were just giving your input, but still, we don't want to derail anybody else that's there to test. So try to keep your own observations to yourself. Just, go to your happy place, whatever you need to do. Talk about the weather, talk about politics, talk about sports. I don't care. Don't talk about the test. Now, after the test, go teach the world. Everybody needs to know these skills. These are good skills for everybody to know. Okay, so teach the world. I do it for free. I don't have a corner on the market, but don't do it on testing day. Good? Does that make sense? Okay, so you're in a waiting room. Now, off of that waiting room are two rooms. There's a clinical room and there's a computer testing room. When they check you in, those evaluators go away for probably about 20 to 30 minutes. Like you're sitting there with nothing to do, wondering when are we going to get the show started? Well, they're actually doing something very important that takes some time to do. They take the 8 people that are there and they divide them up into groups of 2. And there's nothing random about this. It's important that you understand this. There's nothing random about this. This takes them some time. They know what skill set you have. It's actually coded into your Prometric number. So they know your skill set is 8, yours is 5, yours is 6, yours is 2, yours is 1. They know what skill set each one of you has. They're not going to put 2 number 1s together. That makes sense. But they're also going to divide you up into groups based on your body composition. and what you have going on at the moment. So you have a foot issue, right? An ankle issue. You would not be a patient. That worked out perfect. You would not be a patient for ambulating, transferring, or range of motion, hip, knee, and ankle. Can't be a patient for that. So if you get one of those skills, she cannot be your patient. I got to find somebody else to match you up with. Because on testing day, you are both a patient for somebody else testing and the person testing. Good? Good. So let's say that you just had some major dental work done. You got stitches back there. We are not using you for mouth care, denture care, or feeding. I don't want anybody anywhere near your mouth, because if you all of a sudden start bleeding, that is not a routine task on a stable patient. Good? Makes sense? During mobility skills, where you physically have to move another body, they're going to try to pair you up with somebody your body size or smaller wherever possible. So that's something else that they look at. So they're going to ask you during the check-in process, do you have any conditions that would keep you from being a patient for any one of these skills? If you do, let them know. But let me tell you something about your evaluators. In Florida, there are 2. These are people who have a lot of experience in nursing, and usually in either a supervisory or an instructor role. They know what they're doing. They understand their job very, very well. You're not going to get anything by them. But what you kind of have to understand is that they're kind of at the end of their career and they want to be home in their pools, drinking their margaritas. They do not want to be doing this. They don't want to be watching another bed bath, right? But this is their job and they're going to do it to the best of their ability, but they may not be paying super close attention to every single step that you take, because this is the 6th bed bath that they've seen today and the 16th that they've seen this week. And over time, you just kind of check out a little bit. You're paying enough attention to know if something's going wrong. You want your evaluators to not be paying attention to you, because that means that you're doing things the way they expect them to be done. But if you have an evaluator that kind of sits up and goes, what are you doing there? Yeah, you took a wrong turn somewhere. Be careful there. So understand where your evaluators are coming from. Does that make sense? They've seen these skills about 1 million times. They're kind of bored. And they really just want you to get it over with, because they're not punching a time clock. They don't have to wait until 3 o'clock to go home. As soon as the last person leaves, they're out of there. The sooner they can get you guys to go, the sooner they get to go home. So you want to have a pretty good understanding of how to do these skills. You don't want to be restarting over and over and over and over again. You want to be able to get them home quicker. Does that make sense? If you can do that, oh, your skills test will go just as smooth as butter. Good? Make sense? So this takes them a little bit of time to pair you up with another testing candidate that usually doesn't have your skill set, but that you will be a good patient for them and they will be a good patient for you. And once they do that, they're going to come back out to the room and they're going to pair you up. They're going to say, okay, you guys are group 1, don't go anywhere. You guys are group 2. You got about an hour, hour and a half to kill. Be back in here in about 1 hour and 15 minutes, okay? But you can go out to your car and you can study out there or watch TV, your phone or whatever you want to do. You don't have to stay in the waiting room. You can go. You guys are group 3. You've got about 2 hours to kill, roughly. So go Target clearance shopping, see what you can find. Just come back in about 2 hours. You guys are group 3. You've got about 3 hours before you have to be back into the waiting room. So 2 for 1 margaritas at Chili's. We'll see you in a little while. So group 1, we're going to take you into the testing room. Now the testing room is set up very similar to this without the TV. You would have a bed with a patient in it, and it's going to be an old-fashioned hospital bed where the head of the bed will go up and down. It'll have a mannequin in it, and sometimes we use mannequins, sometimes we use people, depends on the skill. I'll tell you about that in a little bit. You will have a supply shelf. You will have a patient bathroom area, and you will have a hamper or something that you can put dirty linens in. But everything will be in one small confined room. Now, the room has to be enclosed with a door because when you're testing, we don't want them to be able to see it. It's a private affair. So the only people in this room are the 2 evaluators, you and your testing partner. That's it. But you've never been there. You don't know where to find the washcloths. So we would take you into the room. We're going to show you how the bed works. We're going to show you what we use as a privacy curtain in this setting. We're going to show you where all of the supplies are, all of the personal care items are, the patient bathroom. If you're working with a wheelchair, they'll show you how to use that wheelchair. If you're working with a drainage bag, they'll show you how to use that drainage bag. So they're going to give you a little mini orientation. You've never been there before. So pay attention to your orientation, but you can ask questions during the skill. You can say, where do I find that bedpan again? Because they know you're nervous. Bedpan's always in the bottom drawer. You may ask, where do I find the gloves? And they'll say, oh, they're over there on that table. You can ask where questions. What you can't say is, so how do I do foot care again? Okay, they can't help you with that. Good so far? Good? Okay, once they have you divided up into groups of 2 and they've taken you into that room and they've shown you around, then one of you will get picked to go first. I'm just going to pick on you because you're closest. Can you give me a number 1 to 11? 5. Okay, so the computer randomly picks skill set 5 for you to perform. You need a patient, so he's going to be your patient for this. And you are going to get very specific instructions as the patient. Be yourself. That's going to be one of the instructions. Don't turn into a 90-year-old invalid. That's not what I'm looking for here. I want you to be you. But be pleasant and cooperative. You're going to say yes. You're going to be cooperative. You're not going to be mean, or this isn't the hardest case scenario. In fact, it's minimum skills competency. So think lowest level. Okay, good. So once he's gotten his instructions and his little script to follow, we're going to focus on you. And the evaluator is going to read these skills to you. You're going to be told to do them in the order listed, and you're going to do those skills on your patient. So you are going to have to measure and record respirations, make an occupied bed, and change position to supported side lying. Those are your skills. Now, each one of those has specific instructions that would be read to you. You would have 35 minutes to do that set of skills. They're not judged independently. It's a global time of 35 minutes. And now that I've given you all of those instructions, I would actually give you that, and you can put it anywhere you want that you can go back and look at it at any time. Okay, so you can take a look at that and then pass it around so that everybody can see how that works. Good? Make sense? All right. So as you're performing those steps, you're going to be graded, and the checklists are actually on the back side of this testing check list or the care plans that are going around. You can see all of the different points that you are being graded on. The evaluators are not going to give you these. They're not going to read them to you. We are. You're going to know all of these steps by the time we're done. But this is what they're actually using to grade you. So when you're in this class, the first 2 weeks, there's no practice time because I've got way too much to explain to you and a foundation to lay before we start practicing. But on week 2 into week 3, and then the week after graduation, you will be able to come in and practice. Okay, so week 2, we have 15 to 20 minutes at the end of class. week 3, we have 15 or 20 minutes. Week 4, we have about an hour at the end of class that's built into the class time. And the week after, you've got 4 hours on Monday and 4 hours on Wednesday that you can come in and practice. So when you're in here practicing, I would grab one of those and I would have the checklist out and give it to a partner and say, I'm going to do this skill. Here's the checklist. Check it off. Okay. So that way you can do a dress rehearsal of the state exam before you go test. Good? Questions? Problem is that this is written for a nurse. You guys aren't nurses. So we've got to have a resource that can help us take this checklist written for a nurse and put it in CNA easy to understand language. And I'm going to show you how we're going to do that in just a few minutes. This lesson talks to you about how we grade the skills. Now, one of the questions that I'm going to get is, Miss Patty, how many steps can I miss and still pass? Very common question. And the answer is, if you were the patient, how many steps do you want your CNA to miss? None. No. You want to be taken care of properly, right? So let me ask you, how many steps should you miss on the state exam? None. Not because you want to pass, but because you want the best possible patient experience. Does that make sense? Good. But I will answer that question for you. How many steps can you miss? And the answer to that is it really depends on the step itself. So let's talk about this lady for a second. Let's say that we have to brush her teeth. That's our care plan, provide mouth care. Is she in a safe position for mouth care? What's wrong? What does that mean? Oh, so we could kill her?
Yeah, no. I mean, she chokes bad enough.
Yeah, right? So if you don't put the head of the bed up, if you don't get this patient sitting up, if we don't get them upright, there is a possible negative consequence there that is serious. Does that make sense? So that might be a kind of an important step, right? Putting somebody up before we brush their teeth because we don't want to kill them. Now, when you brush your teeth and you are standing over the sink, you don't stand like this and brush your teeth. You stand like this. Because as we brush our teeth, we get all foamy, we become a mess, that foam drips down into the sink, right? And we need a place for that stuff to go. If we stood up like this, all of that foam would go all over our clothes and we wouldn't like that. So we do this. But your patient sitting up in bed is not positioned like this. They're positioned like this. So where's all that foamy mess going to go? Yeah. So what could we put over their clothing to protect their clothing from that foamy mess? Sure, a towel. Yeah, a napkin, a paper towel, a washcloth. I don't care. And nobody else does either. What we care about is that we don't make our patient a foamy mess. Good? Makes sense? Okay, so let's think about those 2 steps. Those are just 2 steps out of a whole bunch we got to do, right? 2 steps. But we have putting the head of the bed up that we know could have a very serious consequence to the patient if not done. And we have putting a towel on their chest, which if we don't do, they just become a foamy mess, but nobody has ever died from that. So one of these steps can have a very serious consequence. The other step, a minor consequence. Those 2 steps are not graded equally. If you forget to put the head of the bed up, it's going to count way more against you than if you forget to put the towel on their chest. Do you guys see why? It's the impact on the patient. Are you starting to see the test has nothing to do with you? Okay. It's all about the patient. So when you're talking about the steps of the skills and, oh my gosh, she failed me because I didn't do just this one step. It's not that you didn't do the one step. It's the consequences that misstep have on the patient that they're looking at. Does that make sense? A little bit different way of looking at the test. It's not about you. Okay, good. Every lesson that we talk about in this book, at the bottom, you'll see some review questions. If you can answer those questions, you got what you needed out of that lesson. Okay. So as the evaluators are watching your performance, they're going to be putting check marks in every step that you got right. So anything you don't do doesn't get a check mark. Anything you do but do wrong, you don't get a check mark. So you only get a check mark if you do the step properly. Good? Make sense? Anything without a check mark is called a deficiency. That is what's going to be put into the computer, and the computer is going to decide based on your deficiencies whether you passed or not. How much was that deficiency, that step, worth to the patient? Make sense? Okay. So sometimes you'll see deficiencies. You'll think, I did that step, but you did not do it properly, which means you did not get your check mark. Good? All right. So once you've done the skill, your patient, whoever your patient was, they will get their care plan set. They will be given directions. You will be given a script. You become a patient for them. They do their skills. You guys both go out to the waiting room. Group 2 is brought in. We do the same thing. Show you around. You get your care plan set. You do your skills on her. She gets her care plan set, does her skills on you. Guys go back out to the waiting room. You two come in. You do your skills on him. He does his on you. You go back out to the waiting room. You guys finally stumble in from Chili's. You do your skills on her. She does hers on you. You go back out to the waiting room. So now everybody's done their skills. Now we have to take the written exam. Now, in most cases, the skills are going to be done first and then the written. Not always, though. The evaluators can flip this and do the written first and then the skills. I won't get into why, but there is a valid reason for them making that decision. That's all within their purview to make. Okay. Now, the written test is 60 questions. They're all multiple choice. They're going to be given on the computer. You don't need to have any computer skills other than knowing how to work a mouse. That's it. These questions, by the time I'm done with you, should feel like no-brainers. They should feel extremely easy. Now, along the way, I'm going to give you some test-taking strategies specific for the CNA exam. Each question on there falls into one of 6 categories. I'm going to explain the categories as we go and give you some examples. But I do a live game show twice a month, the first and third Tuesday of every month on YouTube. We give out prizes. It's 15 test-like questions. I explain the questions. You answer them and you compete for prizes by putting your answers in. And then I explain why the right answer is the right answer. Those game shows will get you ready for the written test. I have a whole playlist on my YouTube channel. We've been doing this for over about 3 years now, I guess. So it is available for you. Okay. But I'll be having one not tomorrow, but the week after tomorrow. Your week 2, that Tuesday, I'll be doing another one. If you look at your syllabus on the very bottom, there should be a QR code for the playlist. That'll help you on the written test.
You know, I have a question.
Sure.
You said that, like with the test, don't take your cell phone in.
Mm-hmm.
What about if you have like a smartwatch?
Not allowed to wear a smartwatch either.
Okay.
Yep.
Okay.
No electronics.
Right.
Yeah, they don't want cheating.
Yep. Which makes sense, but
Yeah,
just
because it's a state exam.
important to know so that you don't show up with a watch on. So.
Yeah, they'll just have you put it in a locker.
Right. Okay.
Yep. You can you can wear a regular watch, but there's no need. We'll talk about that a little later in the program, but they actually have a clock right above the bed. And they have another one in the bathroom right above the sink. So you always have access to a timekeeping device. So you don't need to wear a watch for the exam. Okay. Even those skills that are timed, you have access to the clock. Okay. And the evaluators have to use the clock for timing. they're not allowed to use their own watches. They have to use the clock. So you might as well use the same resource that they're using. Okay. Now, I do have a free ebook for you for the written exam. This is if you go to fouryearcna.com/ebook. Again, I've got a QR code on something that we've handed out for this. You'll also get one in the wrap-up email as well. My cord is fraying. Okay, so this is available for you. It helps break down the written test questions into categories and helps you kind of understand. And then this is the QR code for the game show that we just talked about. If you have signed up for our SMS, so if we have texted you or if you allowed us to text you, you'll get a link on Tuesday when I go live. And all you have to do is click that link and it'll take you right in. So Jake sends that out on Tuesday about 15 minutes before my game show. So if you've not signed up for SMS, please do so if you are interested in joining the game show. This is what the game show looks like. I do it from my home office, so the backdrop's a little bit different than what you see in here. But I show you the question, the answer choices. After 60 seconds, we mark the right answer, and you are competing for real-world prizes. T-shirts. We have some new T-shirt graphics that are really cool. Card game and the badge holder. All right, so once you've taken both components of that exam, you're going to get some results. You'll get a result for the written test. You're going to get a separate result for the skills test. It is one exam, two components. You have to pass both to be a CNA. So if you pass the written, but you fail the skills, you only have to retake the skills, the part that you failed. Okay? So this is what the, I'm going to pass this around too. This is what the results page is going to look like. This is the one for the skills. Down here, it starts to tell you what skills you had. It'll be finished on the next page, and it will give you your deficiencies. Remember, this is everything without the check mark. So all of your deficiencies will be detailed here. The deficiencies only count against you in Florida if they're listed twice. That means that both evaluators said that you did not do that step or did not do it properly. If it's only listed once, it doesn't count against you because that means one evaluator saw it, the other one didn't. Okay. Then we also have the results for the written test as well. And the written test has categories. It'll tell you how many questions were in the category, how many you missed. Now, the next question, you guys can take a look at that. Next question I get asked a lot. Remember that these are, everything listed here is your deficiency. But the next question I get asked a lot is, how many can I miss on the written test and still pass? And again, the answer is it's complicated. It's not a set like you can miss 12 questions and you'll be fine. Doesn't work like that because there's 5 categories. Well, you have to pass each category. So let's say that there's 7 questions in one of the categories, providing care for residents with changes. Okay, so that's like all of our patients, right? Everybody's had a change of some kind, because if they hadn't had a change, where would they be? At home, right? They wouldn't be with us. So that's pretty much all of our patients, but you only have 7 questions on that. So let's say you miss 6 of those. Do you think you're going to be a capable CNA? Not dealing with patients that have changes. So we don't need you as a CNA. Does that make sense? We want you to pass every single section to make sure that you are a well-rounded CNA. But there are usually 1, sometimes 2 questions on the state exam where missing that question itself, just missing it, is still just a regular miss. But if you choose a specific answer that causes you to miss that question, it will fail you for the entire exam. Now, these are questions called critical concept questions, And their whole purpose is to make sure that in an emergency, these are all emergency questions, in an emergency, you are not going to put your patient in mortal jeopardy. So what I want you to remember is that fires and residents cannot be in the same place, ever. So if you choose an answer for a fire question, you walk into a patient's room, you see a fire in a wastebasket. If you choose an answer that leaves your patient in the room with the fire, you're going to fail the exam. And that's because in an emergency, we don't have time to go ask the nurse, what do we do? In an emergency, we have to know what we should be doing. We don't have time to go check. So these are emergency questions, and you never, ever pick an answer that leaves your patient alone in an emergency or in an unsafe situation. Make sense? Good? You'll only have one, sometimes two, but usually one question on the state exam that it looks like a regular question, but it's always an emergency question, always. 3 of the answers, 1 of them will be right, 2 of them are wrong, and then there's one that's really, really, really wrong. Don't pick that one. Okay, good? Good? All right, so what if you make a mistake? Well, on the skills test, they actually give us the option to correct our mistakes. Pretty cool. Pretty cool. So let's say we do a whole skill and we realize at the end of the skill that we totally forgot to close the privacy curtain. So we exposed all of them to the world while we did the skill because we forgot to provide privacy. And we're all done with the skill. And we're thinking about our skill. And we realize that we did not close the privacy curtain. We can say out loud, correction. I would have closed that curtain before I began the skill, and I would be opening it at the end. So when you make a correction, that checkpoint gets a check mark. The paper doesn't know whether you did it or corrected it. You get the same credit, doesn't matter. In most cases, the evaluators are going to say, yeah, I need to see that, please. You need to perform the step. But sometimes you can get away with just a verbal. So like you've done the whole skill, it's your 3rd skill. They've noticed you opening and closing the curtain like you're supposed to, and you just verbally acknowledge that you forgot it in this skill. They're not going to need to see it. Okay, but you're going to follow their instructions. If they say I need to see it, we're going to do it. But you can correct anything. You can correct anything. But you have to correct it before you say, my skill is done. Because once you say at the end of your skill, my skill is done, what you're saying is, final buzzer, I'm done here. And they're not going to let you go back and make corrections. So don't rush this. When you get done with the skill, think about it. Go back and read that care plan one more time. Did I do everything on the care plan? Was I on the correct side of the patient? You know, is there something I didn't do properly? Look at that care plan, make your corrections if you need to, and then tell them your skill is done before you move on to the next one. Page 33 tells you all about corrections. And you can go from failing a skill to passing it with just a few words. But it's super important to remember that when you say my skill is done, you will not be able to make corrections after that point for that skill. Okay. And you can say my task is complete, my skill is done, I'm finished. You can say it any way you want to, but they are going to make you close out that first skill before you begin the second. Then they'll make you close out that second skill before you begin the third. Good? Okay, and then you just say, I want to make a correction or mistake or however you want to say it. All right. So this is something that I started telling my students to do several years ago, and it really has improved their pass rates Because when you go back and you look at that care plan one more time before you end your skill, you may see something in that care plan that you did not see at the beginning when you were stressed out that you're about to start your skill test. Okay, so go back and look at that care plan. It will save your grade. Most of the time you have to perform it. They will tell you if they need to see it. All right, any questions on the state exam? We are going to go through test registration together next Wednesday, class 4. I pass out the registration forms. I explain the timeline, the steps. We're going to put everything in the boxes together, and then you are going to register on your own. You do not give me money. I do not register for you. You register independently, but we will go through that whole process at the very end of class 4, about the last hour. That's one class that you really do want to be here for, if at all possible. Okay. $155.
Okay.
Yeah, $155. You also have to have a background check. We'll talk about that in class 4, but budget somewhere around $80, $90 for the background check. All right, so let's talk about the syllabus. This is our syllabus here. These are the books that we're going to be using. And then you also have 2 websites that we're going to be talking about. All right, so we've already talked about this book a little bit. This is our homework book. Remember that I don't always agree with this book. If there is a discrepancy between what I am teaching you and what this book tells you to do, always go by me. This is a very general national book that covers basically CNA in every state. Every state's a little bit different. I have tailored this specific for Florida. So when you have a discrepancy between what I tell you to do and what this book tells you to do, always default to me, because that's based on Florida standards. Okay, good. Remember, there's lots of ways to clean your house. All right. Now, that yellow book, when you go home tonight, you are going to have homework in that yellow book. On Mondays, we read 1 chapter. Between Wednesday and Monday, we read 2. So over the weekends, 2, in between classes, 1. Got it? So tonight, you're going to go home and read chapter 1 in that yellow book. It's like 22 pages. It's not very much. Not bad. This weekend, though, budget your time accordingly. The homework for this weekend is the longest homework you have in this class. Those 2 chapters, 2 and 3, they're long. So break it up into small periods. You know, read for 10 minutes on Wednesday, read for 10 minutes on Thursday, and then again Thursday night. Read a couple minutes on Friday, and then again Friday afternoon. You know, just kind of break it up. Don't sit down at 11 o'clock on Sunday night and think you're going to get it all done. You won't. It's long. All right, so tonight you're going to go home, read chapter 1 in your yellow book, and then we're going to take a test in the spiral book to find out, did we learn what we were supposed to learn from that reading? This is going to be on page 181 of your spiral book. So this test in the spiral book goes with the reading that you did in the yellow book. They go together. Good?
Is it going to tell us at the end of chapter 1 or whatever what page the test is?
No, that's on the syllabus.
Yeah.
So here, let me pull up the syllabus real quick. On your syllabus, you've got, actually, let me go back to that page here. Where's my syllabus? Okay. Let me point to it up here. So on this syllabus, you have rows. You can see this is all class 1 Monday going all the way across this section. You guys see that? And then we have a whole section for Wednesday, and then a whole section for Monday, and then a whole section for Wednesday and all. Then you have these columns. There's 4 columns. So the first column are the skills that we're going to learn in class. So today we are going to learn, well, we did learn skill rules. Yay. We know to follow the care plan, but we still have to learn the opening, the closing, hand washing, and indirect care. So we still have a long way to go, and I've only got an hour to get there. Okay. The second column are going to be the lectures related to what I'm teaching. So if you look at this, we've already talked about the CNA exam, so we can check that off. We've already talked about delegation and liability, so we can check that off. We talked about patient considerations. We talked about the test and care plans, and I passed them out to you. And we've talked about the principles on the back wall that we have to learn. So we're good there, okay? Now, the homework column will tell you your homework. So if you look at that column for today, it'll tell you in the yellow book, we're going to read pages 1 to 20. And then we're going to take the test on page 181. So this third column is always your homework column. That's where you want to go to find out what homework you have. Now, this last column, this is my wish list. These are things I want to talk about. These are lectures I want to give in class, but we may or may not have time for it. I might get to it, but I might not, depending on what's happening in the class. So when you go home, you might want to just take a look at this and see, is there anything there that I need to read that we didn't get to in class? Now, today we went through the 5 key phrases. That's that little house thing that we talked about. We went through the care plan activity. Those are the questions that you answered. We talked about corrections. Now, we haven't talked about warm, dark, and moist, but we did talk about skills grading. So I've done a pretty good job today. I got most of my wish list items done. We will talk about warm, dark, and moist, hopefully, before class is over. We'll see about my timing. All right, so do you guys see how we're going to use this syllabus to work our way through all 4 weeks? And I'll remind you at the end of every class what chapters we're on. Okay, so for tonight, you're going to read chapter 1 in the yellow book, and you're going to do the test on page 181 in the white book. Now, at the very end of the white book, the spiral book, on page 201, you have an answer key. I don't grade in class. I honestly don't care. Because if I'm the body in the bed, I'm not going to look up, what's your name? Christian. I'm not going to look up at you, Christian, and ask, what'd you get on chapter 4? Do you think I care as a patient? I don't even know what your chapter 4 was about. I don't care. What I'm going to hope is that you learned enough about chapter 4 that you can recognize a new symptom in me and report it to the nurse. I want you to understand what the textbook is talking about, not just get a stupid grade on a piece of paper that nobody's ever going to look at again. I am the only teacher on the planet that does not care about grades. I don't. Couldn't care less. I care about comprehension because that's what's going to make you a good CNA, is not just reading about the concepts, but truly understanding them. So I want you to take these tests as often as you need to get to 100. How many of you guys want a good enough surgeon? Or do you want the best in class surgeon? Which one do you want? Best in class, right? Anybody know what they call a guy who made straight D's all the way through medical school? Do you know what we call him? Doctor. He made it all the way through medical school. We call him doctor. Oh, now I made you think. You think every single one of those doctors you see is best in class. They can't all be. Somebody just scraped by, and it could be yours. What kind of CNAs do you think our patients want? Best in class. Yeah. You guys starting to see this a little bit different? It's not just about passing the test. Okay, good. Makes sense? All right, so when you're done with that test on page 181, I want you to go to the very back of the book, and I want you to grade it and just see, did you get them right? If you didn't, you need to go back and look at that book and figure out where you took a wrong turn, and then how do we fix that so that you get 100? Good? When you come back to class on Wednesday, I'm going to go down my sheet, and I'm going to call your name, and I'm going to say, what'd you get on chapter 1? Now, here is our grading scale. So if you missed 1, it'll tell you got a 95. If you missed 2, you got a 90. If you missed 3, you got an 85, and so on. This gives you your score. Or you can just tell me I missed 3. I can do the math. But I'm going to ask you, how did you do on chapter 1? And you're going to give me your scores, and I'm hoping I get hundreds all the way around. That's what I want. But if you tell me I got a 70, that tells me there's something about that chapter that you're struggling with. And then after class, I'm going to ask you, make sure you come see me, and we'll talk about where your struggle is. And maybe I can explain it in a little bit different way so that you get it. Good? So low scores just trigger me to know that you are struggling. Okay? Good? On the front of your yellow book is the letter Y and a number. When I call your name, if you can tell me what that number is, that way I keep track of who has what. Delilah, I'm sorry. On the front of your yellow book. Y6. Jenny? Isaac? Fermana? Y3? Victoria? Victoria here? No. Kaylee? Oh, you also have 3. Okay. All right. Diana? Thank you. Naomi? Did I say that right? Naomi? Naomi? Could be Naomi. Andrea?
Y4.
Sarah?
Y9.
Daisy?
Y10.
Teresa?
Y5.
Christian?
Y13.
And Faith.
Y11.
Thank you. All right. Any questions so far? Okay, we're going to run through this next part pretty quickly. I'm going to teach you all the different aspects of this spiral book. And this is the one that we're going to work out of in class. So this is the one you want to bring back and forth to class. We're going to go through this pretty quickly. I'm not going to spend a lot of time on it because you're going to see the same things over and over and over and over and over and over and over again. So brief introduction. Good? Don't worry if I go too fast because you're going to see this again and again and again and again. 20 times. All right. So each skill that we're going to learn, this is the one for Pulse. This is going to be located on page 52. So each skill we're going to learn is going to start out with an overview page, which is what this is. This page is going to give us the principles that apply to this skill, and they're going to be spelled out for us here. So this is just the name of the principle. This is the actual principle itself. You can see the very first one is skill rules. We know to follow the care plan, the whole care plan, and nothing but the care plan. While we're doing that, we're going to be making observations. And who do we report those observations to? The nurse. That's exactly what this tells us, right? This is our first principle. Good? We also are going to have to do the opening, glove rules, pulse, and the closing, so we still have some things to learn. Up here is our skill-specific steps, a very short version. This is like a 4 or 5 step peanut butter and jelly sandwich. Anybody ever made a peanut butter and jelly sandwich? How many steps are involved?
So many.
Yeah, most people think about peanut butter and jelly sandwiches as being like maybe 4 or 5 steps, right? Peanut butter, jelly, bread, eat. How many steps are there, right? There's actually 42. Yep, there's 42 steps to a peanut butter and jelly sandwich. I have a short on that, a reel on that. Go watch it. I've got more comments on that reel than any other reel I've ever done, right? But what I'm trying to show you is that even things that you are very familiar with have steps integrated that you do without even realizing that you're doing them. That's just kind of all part of the skill. So here's a good example of that, really brief, really quick. How many of you guys have brushed your teeth this month? Okay. All right. Can you tell me quickly, what are the beginning steps of brushing your teeth? What do you do?
Open the cabinet, grab the toothbrush.
Okay.
Turn on the faucet, stick my toothbrush under the faucet, out of the faucet, open my tooth. Well, first I gotta pick up my toothpaste.
There you go. Okay.
I have to unscrew my toothpaste, then I put toothpaste on my brush, then I wet it a second time, so stick it under the faucet again. So if it's not wet, can't brush teeth.
Right.
Then you grab the bottom of the toothbrush and you stick it in your mouth. But you gotta open your mouth. So you open your mouth, stick it in your mouth, and then you brush round in the back, round in the front, round on the other side. Open, get the back, get the top of the back, get the top of the front, bottom of the front, out, rinse, spit, grab a cup off the counter, fill, drink, rinse, spit, and then I put the cup down, put the toothbrush in the cup. Done.
Except that your face is a drippy wet mess and your toothpaste cap is still on the counter.
See? So many.
So many steps, right? But we just are on autopilot. That was a great, let's give her a round of applause. That was fantastic.
My husband had been talking about that question.
Absolutely. That's amazing. You're very detail oriented. So amazing. So here's the problem, that even when we're trying to think of all of those little steps, we still missed a couple, right? Now we have toothpaste on our counter because we didn't put the cap back on, and our face is a drippy wet mess because we didn't dry it off. So the problem is that when we are doing these skills, when we're learning these skills, it seems like a lot of steps. She just explained mouth care. It seemed like a lot of steps, right? And you're thinking, I don't do that. Yeah, I guess I do, right? We do these steps, but we aren't really counting them all as steps. We're just counting it as brushing our teeth. So how do we go from, oh my gosh, this is a ton of steps, to it's just brushing teeth? How do you get there? Practice. It's the only way to get there. It's the only way to get there. I can't shortcut that for you. I can't shortcut that for you. What I can do is present all of these skills in that level of detail so that you won't ever wonder, when do I wet that toothbrush? When do I put the toothpaste on? I am going to be that detailed with all of your steps, and it's going to look overwhelming at first. It really will. But it isn't overwhelming once you've done it a couple of times. So once we've done this a couple times, let's go back to mouth care. Now we don't need all of those steps. We know you got to take the lid off before you put the toothpaste on. You know, we know those things. So we can kind of condense that down to wet toothpaste, put toothpaste on, brush teeth, rinse, dry, right? You can kind of simplify it down to your major steps, understanding that each of those majors has a couple minors in there to make it happen, right? That's what this is. These are the major steps. It's not every step, but it'll get you where you need to go, provided that you have some familiarity with the skill. Make sense? Okay, so when you're looking at this page, you're going to have one of these pages for every skill we're going to learn. We have our principles down here. We've got our skill-specific steps we'll talk about in a minute. You've got your short version. You've got all your principles spelled out for you. You have a video that you can watch. And then down here, we have some skill-specific or test-specific information. Oops, let me go back here. All right. So I want to talk to you about this because this really forms the backbone of our program here. Every skill that we do is going to have some rules that go along with that skill. And when I first started doing this, I started to realize that a lot of these rules were the same across a lot of skills. So like one rule would work for like 7 skills. That's pretty cool. So I created what we call principles, and you'll notice that they're all in puzzle pieces because they can snap together in different configurations to make up different skills. And that's what we're going to learn. There's 11 principles that we have to learn. Now, these principles you can see detailed on page 27. All of them are spelled out for you here. You don't have to go there. It's in your syllabus, but we are going to learn all of these. It's what's on the back wall. When I started teaching CNA, I was not successful. As an RN, I just thought, okay, I'm an RN, I can teach CNA. I mean, what is there to teach? I mean, it's just CNA, right? I can do this. This is easy. And I wasn't very successful at first because I did not understand what the test was actually testing for. And I was trying to create mini nurses. A CNA is not a mini nurse. You are not going to be tested on medical terminology, disease processes, body systems. That's not what CNAs are all about. You're going to be tested on things that are relevant to your job. And I had to figure that out as an instructor. And it took me a little bit of time to put it all together. But because I wasn't successful and I am a perfectionist, this drove me to study the test. And I became a subject matter expert on Prometric testing. Every single checklist that you are going to be graded on, if you take those yellow papers, right, the laminated papers that I passed around, and you look at all of those checklists, you will notice that number one on every single skill, doesn't matter what the skill is exactly the same. Exactly the same. So is number two. Exactly the same. So once I started studying the test and I said, okay, wait a minute. This is the same on every skill. If I teach them to do these things and they do it on every skill, we get some checkpoints. Yay. And then I realized the same thing happened at the end of the skill. There were checkpoints that were all the same. So we use that to create these principles or puzzle pieces, and each one represents a set number of steps that are going to be checked off on the state exam. Make sense? And we're going to mix and match. All right, so number one is the same. Number two is the same. You're good. At the end of the skill, we have a lot of similarities as well. And I use these to create something called the Big Four. Now, this is, these are steps that we're going to do for every skill. It doesn't matter what the skill is. We are going to follow the care plan, always. We're going to start our skill the exact same way with the opening, always. We're going to evaluate if we need gloves, always. We're going to talk about this on Wednesday. And we're going to end our skill the same way, always. Doesn't matter what the skill is, always the same. And if we do this, and I noticed we did the same thing for any time we're going to uncover the patient, or anytime we're working with linens, or anytime we have supplies, or anytime we're washing something, or anytime the patient's in bed, right? I've got some rules that we're going to follow. Well, if you do this, and you learn these rules, then when you're learning the skills, you only have to learn a few steps because the rest of them are just principles that we're repeating over and over and over again. Make sense? It makes the skills become a little more manageable and easier to learn because we're learning them piece by piece. So that's what these are. You can see these principles. These are the 5 that apply to this particular skill. These are the things that we're going to use to get our checkpoints checked off. Our short version, our skill-specific steps we'll talk about a little later. We have a video, and then down here is our test-specific information. The first little area there has time. Now, remember, on page 25, your care plan clipboards, those testing clipboards, they all had a time at the top of them, 31 minutes, 34 minutes, 36 minutes, 39 minutes, right? That's a global time. So when you get that care plan set, you're going to have 36 minutes to do this skill set. It's not time per skill, but I do have the per skill timings here for you because it goes into their formula that they use. Okay. So you can see that here. So the formula that's used, I'm going to go through really quickly, is they take your 3 skills, whatever time for each skill, right? So those 3 add up, and then they give you 3 minutes for hand washing on top of that. Then they give you 5 minutes for thinking on top of that. So they give you lots of time to do these skills. You should not have any reason to time out. My students don't time out. That's not been an issue because you kind of have an idea of what you're doing. Where you get into trouble is if you have no clue and you're having to start the skills over and over and over and over. Where do those evaluators want to be? At home in their pools drinking their margaritas. And what's standing between them and that pool? You. Yeah, they'll get irritated. Doesn't do you a whole lot of good to irritate your evaluators. So we want to make sure that we have a certain level of competency before we go to the test, and that just requires you to practice. Okay, just practice. Practice at home. If you've got a living human at home, you can practice these skills. If you don't have a living human at home, don't use a dead one. That's just creepy. But you can use stuffed animals or baby dolls or something like that to practice. You'll also be able to practice in here as well. I do have a whole lesson on that skills timing on page 71. This is that formula I was talking about. We won't get into that right now, but there is a formula for them to determine how much time you have to do that particular skill set. The next little area here is who you're going to be performing this skill on. In the test, there are some skills that we're going to do on the mannequin. They're just a little too personal to do on each other for the test. So things like bathing, dressing, peri-care, catheter care, those are going to be done on the mannequin. Everything else is done on a live person. And you'll see a little student there if it's going to be done on a live person. Now, this is important for you to understand, though, because when you're practicing, you want to set this up just like it was for the state exam. Don't practice on a mannequin if you're going to be performing on a live person. Mannequins don't move the same way people do. So you want to look at the bottom of the page to find that out. You also want to see where's that person going to be at the beginning of the skill. Are they going to be in bed or are they going to be in a chair? And there are 4 skills that require documentation. If the skill requires documentation, it'll tell you in this last little section, and then it'll tell you how far off you can be and still be considered accurate. That's called the variance. Remember, these are the 4 documentation skills: pulse, respirations, feeding, and drainage bag. You will get one of these. Everybody gets one of these. Good. Let's go to page 53. So what we just looked at was the overview. Now we're going to get into specifics. So if you look at page 53, up at the top of the page, you see the care plan. We've seen this care plan before. It tells us patient will be lying in bed for skill. Take the patient's radial pulse measured at the wrist for 1 full minute and record your readings. We saw that on page 20 when we did, 20 when we did the that quiz at the very beginning. We saw this care plan. That is the care plan you will have for the test. The actual testing care plan. So for the test, they're not going to tell you to count for 15 seconds and multiply by 4. It will tell you to count for 1 full minute. So what do you think is going to happen if you don't count for 1 full minute? No check mark. What do you think it's going to do to your score? Yeah, you're probably going to fail because you did not because you didn't take the pulse right. It's because you didn't follow the care plan. Starting to see how those two are really tied together. All right, down below that are step-by-step instructions based on that checklist. Now, understand that checklist is written for RNs specifically. So this is made for me when I'm checking you off skills, not for you to check each other off. So what I did is I took this checklist, filtered it through the RN brain, and I wrote out step-by-step instructions telling you how to get those check marks. Good. Now, I am insanely detailed. Insanely detailed. So there is nothing to chance here. It'll tell you when to take the cap off the toothpaste. It tells you everything in the order it should be done. But remember that unless the checklist gives us an order, a specific order, this is like cleaning your house. It doesn't matter which you start with. Okay, there's some latitude here. Make sense? Make sense? What we want to look for is first, before, those types of things. And when I see those they're called order words. When I see those order words, I make sure that I put them in your step-by-step instructions so that you have that information. Good? Good? All right. So this is going to tell us exactly how to do those steps. Down here at the bottom, we have our supplies. What do we need to do those steps? And you have to learn your supplies. Nobody's going to tell you, okay, I need you to go in and give the patient a partial bed bath, and you're going to need a barrier for the table. You'll need 2 towels, 4 washcloths, soap, lotion, basin, a clean gown, and gloves. I'm not going to tell you all that. I'm just going to say, go give a partial bed bath in room 216. And I expect you to know what you're going to need to do those tasks. So you are going to have to learn your supplies. And yeah, I know it's a lot. This one's easy. This one's easy. There's only 3. One of them is a pen. Okay. This one's easy. But there are some where you have a lot of supplies that you have to learn. Flashcards are your friends here. So if you make your own flashcards, that is best because you will learn by writing it out. That is best. If you don't want to make your own flashcards, you can purchase mine. I have flashcards made up here that we sell. They have all of the principles that we're learning. They have the supplies for every skill, and they have the short version, the steps for every skill. So you can purchase these if you want. I do give them to you at a discount. Make your own. Okay, make your own. If you're looking at those supplies and you're like, I don't know, is a privacy blanket the same as a bath blanket? I don't know. Page 37 gives you all of the supplies and the other names that they're known by. A gate belt is a transfer belt. A privacy blanket is a bath blanket. A wash basin is a bath basin. So in healthcare, everything has 2 names. I don't know why I didn't make the rules. But page 37 shows you your supplies. And then for every lesson in the book, we have some questions there to help you understand, did you get what you needed to get? So you guys are in the actual classroom program. You are here live, in person. You are participating. You are sitting here. But you also have access to the online course. The online course, the classroom program, best you can get, top of the line. It'll give you everything. But that online course will give you a way of practicing without physically practicing. The online course has a ton of interactive activities in it. It has you pull the supplies that you need virtually. You have to go to the supply shelf and click on the things that you need. It's a great way to learn your supplies. It has you put the steps in order. It's a drag and drop we're going to do together in a few minutes. Drag and drop where you put the steps of the skill in order. That is super important because on the last week of class, I'm going to end at like 11:30 or 12. I stop talking. And I'm going to say, okay, class is open for practice. And we turn off the camera. Nobody out there gets to see you guys practicing. And you have the ability to get up and practice. But if you don't know the steps or the order those steps need to be done in, you'll get up here and you'll go, and then you get flustered and you sit down and you don't practice. So my suggestion to you is to make sure that you're doing the skills in the online course to get used to the supplies, to learn the steps and learn what order they're in so that when it comes time to practice, you have all the tools that you need to actually get up and practice and you're not intimidated. And you've all been entered into this as part of the class. I actually charge $149 for this individually. You guys all get it as part of your enrollment. And tons and tons and tons of people do nothing more than that online course. They never come to class. They just do that online course and they pass the test. In Florida, tons and tons of people just watch my skills videos on YouTube. That's all they do. And they go pass the test. How much further along are you going to be? You're going to be fine. You're going to pass the test with flying colors. Okay. All right. So when we're learning these principles, this is really what it comes down to. What if I told you that you just had to do one thing at the beginning of every skill and you get a bunch of checkpoints? Would you do that one thing at the beginning of every skill to get a bunch of checkpoints? Every time, right? That's a big, that's a huge benefit, right? I do one thing, but I get 7 checkpoints. Yay. Cool. That is called the opening. And when you're looking at, this is the checklist for Pulse. Okay. This is what we're trying to get checked off. If we do the opening, look how many things get checked off. Almost half of our checklist. Wow. That's a lot of bang for our buck. I learn one thing and I get half of this checklist taken care of. I like that. This is how I built the principles. So let's learn that one thing. Let's go to page 30 and we are going to learn the opening. The opening is going to be done at the beginning of every skill. It doesn't matter what skill that we do. It has some very specific steps and they must be done in order. My notes for this are on page 31. Your opening sounds like this. Good morning, Miss Jones. My name is Patty. I'm your CNA today. How are you? I'm here to whatever, insert name of skill here. Is that okay? I'm going to close your curtain, wash my hands, get my supplies. I'll be right back. That's your opening. We're going to do that at the beginning of every single skill that we do. It doesn't matter what the skill is. It doesn't matter if you just left that room. Let's talk about that for a second. Because I've noticed a trend lately. People will do their opening for the first skill and then they skip it for the second and third because they're still in the same room with the same patient. But for the test, these are 3 separate patient encounters. Even though you didn't physically leave the room, you have to pretend like you physically left the room. We're going to do the opening for every skill, not just the first one. Does that make sense? Okay. So our opening, we read the care plan first because we have to know what to do. And then we do our opening. Every skill starts with an opening. Every opening starts with a knock. Remember, our patient is not home. They're in a strange place, surrounded by strange people that they don't know. They're not dressed for company. Everybody that walks in that room hurts them in some way. They have no idea who you are or what you're about. We got to make our introductions here. But part of that is to knock before you enter. If you just walk in that room, that really removes any expectation of privacy that that patient has. You're invading their space without any sort of acknowledgement that it is their space. Good. An analogy I like to give, has anybody ever stayed in a hotel? When you stay in a hotel, that's not your room, right? You've rented it, but you don't own it. It's not your room. You're going to be vacating at some point. You're there temporarily, correct? So that room really belongs to the hotel. Now, there's people that work there like maintenance and housekeeping and management, right? There are people that work there, but they don't just come barging in your room at 2 a.m. Just on a whim, right? They have to knock. They have to announce themselves because you've rented that room. Hospitals, nursing homes, same thing. That person is renting that room. And we can't just barge in with no acknowledgement that somebody is in that room. We have to knock. Can you imagine how strange it'd be? 2 a.m., you wake up in a hotel, you look up and there's a maintenance guy standing over you with a wrench. Can you imagine? Right? But that's what we do in healthcare a lot. We walk into the room without announcing ourselves. We just walk in, and we're also standing over the patient with sharp objects like needles. And we don't really stop and think about the experience the patient is having with that. So always knock first. That keeps that space private for the patient. But there's another reason to knock as well. I want you to think about all the things you do behind closed doors. Go ahead. Think about all the things you do behind closed doors. Now, if they're behind closed doors, that probably means you don't want anybody walking in on whatever it is that you're up to. Correct? Okay. When you enter a patient's space and that door is closed, you are entering a closed space, and they may be up to any number of things that are normally done behind closed doors. You can't unsee things. Preserve your eyes. Knock. Okay. Good. Okay. So every skill starts with the opening. Every opening is going to start with a knock. This is a graded checkpoint. Every single skill has this as a checkpoint. Announce self or knock before entering room. It's a graded checkpoint. Once we've knocked, we're going to enter and greet the resident, and we want to be nice. Remember our bucket of nice? We want to be nice. So good morning, good afternoon, hi. I'm going to be as nice as I can be. And that's how we're going to start this encounter. I'm not going to grumble about the nurse. I'm not going to complain about the shift. I'm not going to talk about the other patients. I'm not going to complain because I didn't get my lunch. None of that is my patient's responsibility. My job is to be nice. So good morning. And this is a graded checkpoint. Greet the resident. We also have to address them by name. Now, for the test, we're not going to use ID bands. There are no ID bands. Nobody's going to put an ID band on you for the state exam. And it's important to understand that if we're providing care where the patient lives, like nursing homes, assisted living facilities, home care, there will be no ID bands because that is where they live. How many of you guys have to put an ID band on when you go into your home so the people there know who you are? Right? You belong there. It's your home. Same thing. So there's very, very few places in healthcare that actually use ID bands, and most of those are acute care short-term stays. Make sense? So you will go by your policy and procedure on whether ID bands will be used, but they will not be used for the test. We are going to announce our patient's name out loud. Hi, Mrs. Jones. Good morning, Mr. Jones. For the test, we just use Jones. Everybody in here is now Mrs. or Mr. Jones. Congratulations. Okay. We just use one name, make it easy for the test. But this is kind of important. And we kind of have to understand a little bit about why, okay? When you go to a doctor's office, you don't get an ID band. They show you into a room. They talk to you, get your medications, what you're there for, all of that kind of thing. And then they close the door and put your chart outside that door. When the person that's going to see you walks in, they grab that chart, they walk in and they look at you and they call you by name. And if that's not your name, you're going to tell them, hey, that's not my name because you don't want whatever they got in store for that person. You're going to let them know, hey, I am whatever your name is. This is the same process. The most accurate source of confirmation of who a patient is themselves. That is the most accurate way. If I want to find out your name, the best way for me to find out your name is to ask you, what is your name? if I think I already know your name because I'm holding a piece of paper that has your name on it, and I say, Delilah, is that correct? Yay, one. And I say, how are you doing, Delilah? Okay, so this is Delilah. Everybody now knows this is Delilah. But if I walked in and I said, hi, Charity, how are you today? What are you going to say? Yeah, I'm not Charity. No, try again. Make sense? Good. Single best source of confirmation of a patient is the patient themselves. Now, some of you are going to go, but wait, Miss Patty, what about dementia patients? What about stroke patients? What about patients that can't identify themselves? Hold up. We already have that process in place because the nurse has done an assessment. The nurse now knows the patient cannot self-identify, and the nurse would put a process on the care plan that would tell us how to identify that patient. We already have that process. But that doesn't apply to the test. For the test, we're going to announce them by name. So far, I've knocked, I've greeted, good morning, and I've announced them by name, Mrs. Jones. Good? Now, I like to throw in a how are you? Because I'm clearly here to do a skill. That's why I'm here. Not to visit. We're not playing cards. I'm not putting together puzzles. I'm here to do a skill. Now, I really need to know that this patient's kind of on board with that. So I like to ask, how are you? Because if this person says, oh my gosh, I've got a horrible headache, or my back hurts, or I'm nauseous, or I don't feel so good, I can stop right there. I'm not going to go through the rest of it. We're not going anywhere. We're not doing anything. That is a change. What do I do with changes? Report it to the nurse. So I'm going to stop what I'm doing. I'm so sorry to hear that. Let me go get your nurse. And now I've just saved myself a ton of time. Okay, so I like to ask, how are you today? It also makes them feel cared about. And patients are much more compliant if they feel that you care. There's an old saying, nobody cares how much you know until they know how much you care. Okay, good. So that's part of showing that we care. It is a graded checkpoint. We also don't want to use a term like honey, sweetie, dear, love. We're not going to use anything that is unprofessional. There's a couple reasons for that. Number one is that we are a professional part of the healthcare team. Okay, we're not, and servers do this a lot. Servers will call you honey, dear, sweetie, but servers aren't into your most intimate places. Servers aren't seeing you undressed. CNAs are. You start calling somebody honey, baby, sweetie, and you seeing all their dangly bits, they might get the wrong idea. Does that make sense? The lines there can get blurred pretty quickly for the patient because in a very real way, you are the one caring for them. And they can misconstrue that care if we aren't setting good boundaries there. So no honey, baby, sweetie, dear. We're going to keep it Mr. or Mrs. Now, we're very informal in our society, very informal. I think we've lost something by becoming so informal. With older individuals particularly, I rarely call them by their first name. I try to stay to last names. So if I'm going in and I say, hi, Mr. Smith, and he says, oh, call me Harvey. I'm not real comfortable with that because I need that level of professional separation. I don't really want to be on a first name basis with you. So if they really want to be first name, I'm putting a Miss or a Mr. in front of it. Okay, Mr. Harvey, because I'm still maintaining a separation there. Okay, good. But I'm a Southern girl. I was raised in the South, so we just do that naturally. But there is a good reason for it. Okay, good. I don't want to be an equal to my older. They've got so much experience, so much life. I am not their equal. I am not their peer. And I don't think that I need to pretend that I am. especially in healthcare, more respect will get you farther than more likability. Does that make sense? Okay. All right. So now they need to know who you are. And it's not just, hi, I'm Patty. So are you Patty that brings the needle, or are you Patty that brings the cookies? Because I like those two people differently, right? So, hi, I'm Patty, your CNA today. You want to give them not just your name, but your title as well. Don't ask somebody to let you see all of their most personal spaces if you aren't willing to tell them who you are and why you're there. That's a big ask. That's a big ask. So a long time ago, I taught a class called Health Science Concepts, and I really tried to get this point across, right? So I asked my students to come up with a scenario that would be very awkward. Think of a scenario that would be very awkward if a stranger came up to you in a place and asked you to what, right? If a stranger came up and asked you to do something, what's the most awkward thing that you could come up with? So I'll give you a couple of examples. If I stood in a Walmart bathroom and I saw you come in and I said, okay, let me help you toilet. I'm going to go into the stall with you and help you toilet. You would not toilet. You would turn around and walk out because you don't need help toileting. And who am I and why am I here? That's just really high on the creep meter. I don't need help with that. Thank you very much. If I went into the movie theater and you're sitting there eating your popcorn, the lights are starting to come down and I've got a basin of water, I say, okay, I'm going to do foot care on you while you watch the movie. Go ahead. I'm just going to take your shoe and sock off. How many of you guys are okay with that? You don't know me. You don't know why we're doing this. And that is just weird. Now, as weird as those two things are, now imagine I come up to you with a toothbrush in the middle of Target and say, open wide, here I come, right? How awkward would that be? This is exactly what we're asking of our patients, guys. And as awkward as we think it is for us, it is equally as awkward for them. If they can brush their own teeth, they're going to brush their own teeth. You're not going to be anywhere near them. I promise you that. If they can toilet themselves, they're going to toilet themselves. You're not going to be anywhere near them. I can promise you that. Patients are only going to need help or get help with the things they need help with, things they cannot do on their own. And it's important that we understand where they're coming from so we can meet them where they're at. Does that make sense? Part of that is letting them know who we are and what qualifications we have to help them with toileting or with mouth care or foot care. Good. So we're going to tell them not just who we are, but what we are as well. These are graded checkpoints. Then we're going to tell them what we're there to do. I'm here to fill in the blank, insert name of skill here. Now for the test, you can put this in your own words. I'm here to do foot care. I'm here to brush your teeth. I'm here to do some exercises. I'm here to take your vital signs. Put it in any terms you want to. It's fine as long as the patient understands what you're there to do. But for the test, you're probably going to be pretty nervous. And as soon as they hand you that yellow sheet, that yellow care plan set, and they read it to you, and it is go time, and you are ready. I'm just going to take this real quick. You are ready to start your test. Now, you're going to tell them when you're ready to start. They give this to you, they read it to you, and then they tell you, let me know when you're ready. And you'll say, I'm ready. And now it's go time. You're probably going to forget your own name because it's test time and you're being watched. And nobody likes being watched. Nobody. So you can take this care plan set that they've given to you and you can read right off of it. Good morning, Miss Jones. My name is Patty. I'm your CNA today. How are you? You're good. I'm here to provide mouth care to a resident who has dentures. Perfectly okay. You'll get credit for it. It's a bit awkward, but it's okay. Over time, when you get more comfortable with this, you'll just, I'm here to clean your dentures. Is that okay? You'll settle into it. Good. Either way is fine for the test. You can be awkward. You can be awkward for the test. Read it right off the care plan set if you need to. It is a graded checkpoint. And then we're going to ask them the most important question in healthcare, is that okay? Patients have the right to determine who touches them. They have that right. They have that right. So we're going to make sure that we get permission before we do anything. That is a graded checkpoint. And then we'll close the privacy curtain to provide privacy while we're doing the skill, and that is a graded checkpoint. And then we're going to wash our hands. Now, the order of this matters. This curtain is not clean. Everybody touches this curtain. Everybody touches that curtain. And most healthcare workers are touching that curtain with soiled gloves. So there's tons of body fluids on here. Your patient deserves you to have clean hands when you're touching them. So once we close that curtain, what do you think the next thing we need to do is? Wash our hands. So that will be the last step of the opening, is to wash our hands. Now that we have clean hands, we can go get clean supplies. But we have a cardinal rule here, a rule that we cannot violate, and that is refrain from touching resident until hands are clean. This rule cannot be violated. Do not touch a patient until you have washed your hands. Good? Then go get your supplies, whatever supplies you need. All right. Patients are the ones at risk. We're going to talk about that a little bit more next class. So this is one of the sequencing activities of the online course. Okay, if you go into the online course under the opening, I've got a video there, and then you'll see this. These are all of the steps of the opening, and we're going to try it together. Now, on the online course, you want to grab the bottom of the card, like where the letters are, and you're going to move it where you want it. Okay, and you reorder these cards to get them in the right order. So if you look at these steps here, we have gather supplies, knock on door, wash your hands, identify patient by name, read the care plan, explain task, and ask if it's okay, close privacy curtain, and say your name. If you're looking at all of those steps, which one comes first? How do we know what to do with each patient? Read the care plan. So we're going to do that first. Now, what do we want to do? Knock, right. Now, okay, yeah, we want to, you want the patient to know that you know them before they know you. So we're going to identify them first. So it's them, then us. Good? Them, then us. Now that the introductions are out of the way, what do they need to know? Explain task. Why are we there? Then close the curtain. Okay, now that we've got permission. And then wash hands. And last, we'll get supplies. So once we've got them all drugged to the right area, we're going to hit this little check button. And if we did it right, we'll get a gold star. Let's see. Gold star. Now, if we got them wrong, all of these are outlined in green because we got them all right. But if we did something wrong, the ones that we have in the wrong order are going to be red. It'll have a red outline with an X. And when you click retry down here, it scrambles all of them. It doesn't keep the right ones in the right order. It scrambles all of them and you start over again. And this is what we call enforced progression to make sure that you truly are getting not just getting lucky. These are great activities. We have this for every single skill that you're learning. Okay, good. So our opening is knock, knock, knock. Hi, Mr. Jones. My name is Patty. I'm your CNA today. I'm here to whatever. Is that okay? Close curtain, wash hands, get supplies. We're going to do that at the beginning of every single skill that we do from here on out. Now, at the end of every skill, we're going to do the closing. It's another set of prescribed steps that are going to get us a ton of checkpoints. Now, closing, the number of checkpoints kind of varies by skill. You're not going to get as many as opening for some skills, But for others, you'll get more check marks in the opening. So the number kind of varies, but we're going to do the same steps all the time. Our closing is going to be located on page 34, written out for us on page 35, and there's 8 C's to the closing. Now, with the opening, the order mattered. With the closing, the order does not. Nobody cares how you do it other than these last 3 here, okay? You want to make sure your patient's in a clean and safe environment. A good rule of thumb is always leave your patient looking better than you found them. So clean up the environment, arrange the sheets, fluff the pillow. Make your patient look and feel better than you found them. It's a graded checkpoint. We're going to make sure the bed is in the lowest position for safety. That is a graded checkpoint. We'll talk about that a little later in the program. We're going to ask if they're comfortable. They need to hear that word. That is a graded checkpoint. We're going to ask about preferences. Can I get you a magazine is the one we use for the test, but it just shows that we understand there are emotional considerations, not just physical ones. Can you imagine how boring it is not to have anything to do? So we're going to address preferences. You want to make sure they're covered with either sheet or clothes, but we should never see their knobby knees. I'll talk about that later. That's a graded checkpoint. We're going to open the curtain. Don't leave the curtain closed. That isolates the patient, can lead to delayed healing and depression. So open the curtain. Now, if the patient complains, says, I want that curtain closed, who should know? The nurse. That's an observation. So that's a graded checkpoint. We're going to give them their call light, should be in or near their hand. That is a graded checkpoint. Guys, this is the only thing that sets our setting apart from their house. It's not the doctors. It's not the nurses. They're not at the bedside 24/7. The only reason a person is in an acute care setting is to have direct access to help. That is it. That is the only reason they're there, to have quick access to help. So if you are a CNA that hides the call light because the patient is misusing the call light, you have effectively made their stay irrelevant. This is the only reason that people are in an acute care setting. Doctors could go to a house as infrequently as they show up. Nurses are not in the room, but maybe 6 minutes out of every 12-hour shift. The reason they're there is if something goes wrong, we need quick access to them. They're unstable. So call lights, the most important step in the closing. Good? Okay. It's a graded checkpoint. We're going to wash our hands after we do all of that. And then we have our master step here, in skill with clean hands. That means it's the very last thing we do. Doesn't matter what else we've done. The very last thing you should do is wash your hands. So we do our closing. Thank you very much, Ms. Jones. Is there anything else I can get for you while I'm here? Are you comfortable? Would you like a magazine before I go? Environment's clean. Bed is in the lowest position. Here's your call light. Open the curtain. I've done all of those things. Okay. Now I'm going to go wash my hands. But if I need to document, I'm going to do that after I wash my hands, because when I document, I'm picking up a pen, and that pen has been in my pocket, on a table, all kinds of places. But it's also going to go back into my pocket and home with me at night. I don't want to bring germs to that pen. So I wash my hands, I pick up the pen, I document, and then I wash my hands again at the end. So we end skill with clean hands. Good? Make sense? All right. Okay. So your closing sounds like this. Thank you very much, Ms. Jones. I always thank my patients. Always thank my patients. They're the reason I get a paycheck. If you're going to write me a paycheck, I'm going to thank you. So they're the reason that I'm here. Thank you very much, Ms. Jones. Is there anything else I can get for you while I'm here? Are you comfortable? Would you like a magazine before I go? Environment's clean. Bed is in the low position. She's covered. Here's your call light. If you need anything at all, let me know. I'm going to open the curtain, go wash my hands, chart if needed, wash my hands again. And then I'm going to review my care plan. Make sure I got all of this stuff done right. And then I can tell the evaluator my skill is done. So a lot of steps in the closing. Not all of them count for every skill, but we're going to do them all each time. Good? Good. You're going to hear this lots and lots and lots of times. So don't worry about getting it all today. By the end of the week, by the end of Wednesday, you'll be singing along. Okay? You want to end the skill with clean hands and a patient that feels cared for and cared about. So on Pulse, which is the skill that we kind of started with, we did the opening and got all of those check marks. We did the closing and got those check marks. There's not much left that has to do with the skill itself. So we learned the opening, we do it for all skills. We learn the closing, we do it for all skills, and we get all of those check marks. Now when we're learning skills, we only have to learn a very, very few things. Makes learning a little easier. Good? Good. All right. So we're going to talk about hand washing. I'm probably going to keep you like 2 minutes long. Just bear with me, okay? We're going to learn how to wash our hands. Page 44 has the step-by-step instructions along with a checklist that you're going to be graded on. Page 45 gives you my instructions there. But I want to explain to you the dangers in a bathroom. Bathrooms are warm, dark, moist places. We turn the lights off when we leave the bathroom. We usually don't have the air going full force into a bathroom because we don't like to be chilled when we get out of the shower. So we already have warm, dark, and of course the bathroom has lots of water, so we have moist. Warm, dark, moist environments are the breeding ground for most pathogens. So we have to kind of keep this in mind when we're working in bathrooms, that it's a pathogen-rich environment. Make sense? Good? All right. So when we start hand washing, we're going to turn the faucet on. You can turn it on with your bare hands. Your hands are dirty. The faucet's dirty. Nobody cares. Turn the faucet on. Make it comfortable for you. It doesn't have to be hot. You can't wash your hands with water hot enough to kill germs that's boiling. You would take your skin off. So just make it comfortable. Okay. So we're going to wet our hands. This is kind of like the toothbrush principle we talked about a little while ago. You have to wet your hands before you put soap on. Otherwise, the soap does not spread properly. Same thing with toothbrushes. We wet the toothbrush before we put toothpaste on it. Otherwise, it doesn't spread properly. So wet your hands. Then you're going to apply soap. And yes, you've got to get a lot of soap because bubbles count. You've got to work up a good lather for the test. We're going to scrub for 20 seconds. So this is all surfaces for 20 seconds. And we're going to use that clock, not a song. I know COVID taught us all to sing songs. Because when you're nervous, your singing speed is going to speed up. It's not an effective use of time. Okay, good. Make sense? All right, once you've cleaned your hands, all surfaces for at least 20 seconds, you're going to move on down to your nails. We're going to run our thumb down each nail to get our cuticle, and then we'll circle the nails on the palm of our hand to get underneath the nails. So these are all of the areas we want to focus on. We're going to rub the backs of the wrists, in between the fingers, in between the thumb and index finger, the bottom of our hand by our pinky, and the palm of our hand. All surfaces for at least 20 seconds. And then we're going to move on to our nails. Don't sing. Use a clock. Good? I'm going to show you this video. It takes less than a minute. Okay. Oh, sorry. Let me go back. Okay. So once we've done all that rubbing and gone down each one of our nails, and the video is going to show you this in detail, going down each one of our nails. We've circled our nails on the palm of our hand. Now we've got to rinse. When you rinse, keep your hands lower than your elbows. You don't want all that stuff running up your arm. You want to keep your hands lower. You're going to rinse all surfaces. Don't touch the sink or the faucet because we don't want to contaminate. And when you're done rinsing, don't shake. We do this a lot. You want to tap. Tapping keeps the water confined to our sink. Shaking spreads it everywhere. Remember, warm, dark, moist. You want to try to control water in the bathroom area to prevent pools of pathogens from growing. So we're going to tap. And then we're going to get our paper towels to dry. I don't care how many you use. Use 2, use 10, use 26. I don't care. Nobody does. But don't touch anything not washed with those paper towels. If you take paper towels and you pat dry here, and then you go up here, and then you come back down here, what did you do? Yeah, recontaminated. Absolutely. We'll throw that paper towel away, and then we're going to get a clean, dry paper towel to turn our faucet off, because wet paper towels can rip. And if it rips and your hands touch that sink faucet and you didn't know that you touched the faucet, you've recontaminated, and you'll take that contamination to your patients. So dry paper towel to turn the faucet off. That way you can look at it and make sure it didn't rip. Good? Good? Everybody okay? All right, Jake, go ahead and throw that on the video on. As I approach the sink, I can touch the faucet with my unclean hands because the faucet is not clean. I'm going to turn the water on to a comfortable temperature and wet my hands thoroughly. You must rub with friction for at least 20 seconds. I'll get enough soap to produce a nice rich lather and bring my hands together to start timing. I'm going to rub the tops of my wrists on both sides, the back of my hands, interlacing my fingers, in between my thumb and index finger, making sure that I cover all areas with sufficient friction. The bottom of my hand by my pinky and the palm of my hand. After cleaning my hands, I'm going to go down my fingers with my thumb to clean the cuticles. I'm going to circle my nails on the palm of my hand and then rinse. Being careful not to touch the faucet or the inside of the sink. After rinsing, I'll tap to keep the water confined in the sink and then dry my hands thoroughly with paper towels, being careful not to touch the unwashed portion of my lower arms. I'll throw those away and get a clean dry paper towel to turn the faucet off because wet paper towels may rip and contaminate your hands. Okay, so here's the steps put in order. This is another drag and drop activity. I just kind of skipped to the end here. We're going to turn the water on, wet our hands, apply soap, lather all surfaces, rub for at least 20 seconds, rinse, dry hands and throw that paper towel away, and then turn the water off with another paper towel. Any questions on hand washing? Okay, you guys should all be practicing your opening when you walk into the bathroom every time you walk into the bathroom. Make a note, put it on your mirror. You should do your opening when you walk in. You've got a door to knock on, the bathroom door. You've got a person to talk to, the one in the mirror. Hi, Miss Jones. My name is Patty. I'm your CNA today, and I'm here to whatever. Is that okay? I'm going to close the curtain, your shower curtain, and I'm going to wash my hands. You've got a sink right there. You should be washing your hands. If you do that every time you walk into the bathroom for the next week, by the time we get into practice, you'll have the opening down, and that will be easy for you. You can concentrate on the steps of the skills themselves. So put a little index card on your mirror, and every time you walk in, do the opening. Now, if you want bonus points, do the closing before you leave. Okay? Good? Any questions on that? Okay, we do have this video on our main website, foryourcna.com. You can watch that video again as often as you need to. Step-by-step instructions are in your book as well. Indirect care, really quick, it's how you treat your patient. Be nice. That's really what you need to know here. It's going to encompass your tone of voice, your mannerisms, your, eye contact, all of those nice things. But indirect care also, I have a whole lesson on it, but indirect care also covers things like standard precautions, infection control, comfort needs. I'm going to cover all of these in skill instruction. Just remember, nice. We are nice. Okay, good. Questions? Homework for tonight. You're going to read chapter 1 in this book. You're going to take the test on page 181 in this book and grade it using the last page in the book. If you have any questions, bring them to class on Wednesday and we'll go over them together. Okay? So chapter 1 in this book, page 181 for the homework, grade it using page 201, and I'll ask you for your grades when you come in on Wednesday. You will get an after class wrap-up email in your email. If you don't get it, let us know on Wednesday. We can resend it to you. And Jake has already passed out your review sheet for today. If you fill this out while the information is fresh in your mind, for every single class, when we give you these review sheets, this makes your study packet while you're waiting to test. Okay? Thank you guys so much for hanging out with me today. We will see you again on Wednesday at 9 a.m. Until then, be safe out there and happy caregiving. Bye.